ना फिक्र करो, ना फिक्र करो, हर लम्हा हर घड़ी हम तुम्हारे साथ हैं। Our doctors will always there for you.
It is really creditable. Now I would like to invite the leader of the evening, Dr. Sunita on the stage. Radiologist and nutritionist also. बस उस तक पहुँचने के अलग-अलग रास्ते होते हैं और हमारा मकसद भी एक है, साथ सेवा। बस उसके रास्ते अलग-अलग होते हैं और उन्हीं रास्तों पर एक रास्ते को ले जाने को मेडस्केप इंडिया का एक छोटा सा प्रयास है।
ना फिक्र करो, ना फिक्र करो।
Our very own founder and chairperson of Medscape India.
ना फिक्र करो, ना फिक्र करो, हर लम्हा हर घड़ी।
मेडस्केप इंडिया एक ड्रीम है और एक पैशन है जिसे मैंने बहुत साल पहले ड्रीम किया था कि मेडिकल कम्युनिटी के द्वारा जो भी काम होता है इस ऑर्गेनाइजेशन के द्वारा दिख सके।
लोग भी मेडिकेट से ज्वाइन है, उनकी पहले डॉक्टर्स में हैं जो उनके साथ मिलकर यहाँ के लोगों के लिए काम करते हैं।
हम लोग ने मेडिकल कैंप भी लिया हुआ है, 3-4 कैंप हुए, उससे यहाँ टक्कर वापस के पब्लिक को बहुत सारा फायदा हुआ है।
40 डॉक्टर्स मिलकर अनोखी पहल जो मेडस्केप इंडिया का एक प्रोजेक्ट है इसके लिए काम कर रहे हैं। हम लोग अवेयरनेस ला रहे हैं ताकि कैसा टीबी को जो स्प्रेड होने से रोका जा सके।
With that, we conclude this extremely enriching and enlightening event of Fit India Conclave 2020.
Warm welcome to our Honorable Union Minister and elected chairperson of WHO Executive Board, Dr. Harshvardhan. We take this opportunity to congratulate him for this milestone achievement on behalf of our doctors.
Doctors also and many other paramedics in our fight against COVID. Today morning itself I was confronted with the sad news of the death of an anesthetist in Delhi who was admitted in Max Hospital for the last couple of days.
We are the doctors, we're always there for you. We are the doctors, we're always there for you.
This is Dr. Himanshu Mehta.
I'm Dr. Ali Rani from Nanavati Hospital.
I'm Dr. Sunita Dubey.
I'm Dr. S.S. Gill from Amritsar, Punjab.
As we know, the country and the whole world is going through the COVID problem. You need healthcare professionals to treat all kinds of patients from all states of the society.
The Fit India program that you had been working on, and this is something which is really remarkable. And I know that we as doctors, in fact, we ignore our own health quite a bit. The very fact that
Medscape India is an organization, it's an NGO which supports all the doctors in the country.
Because as a doctor, we cannot stay at home and try to help the community as much we can do.
I am happy to know that Medscape India, AMET, a non-profit organization of volunteer doctors and respected for the great service that they render to humanity.
I'm Dr. Ross Walker and I'm a cardiologist. The major point I'd like to make to the people of India is the best treatment of heart disease, cancer or any modern illness is not to get them in the first place. It's called prevention.
My advice to all viewers is to do exercise every day, eat well every day and read well every day.
This multi-pronged strategy comprised of A. Setting up dedicated hospitals, isolation wards and COVID care centers. B. Emergency procurement of ventilators, PPE, masks, oxygen supply drugs. C. Strengthening the diagnostic network all over the country.
Last 2 months, we all are working for the COVID and trying to help the people because the area where I have a hospital, it is 8 to 9 lakh population, Gurla East.
Tumhare saath doctors, we're always there for you. We are the doctors, we're always there for you.
And I'm here to talk about what has become the most important focus of medicine over the past few months. And this is the unprecedented pandemic that has affected the entire world, and of course I'm talking about COVID-19. To this point, there have been 9 million cases and around 500,000 deaths from COVID-19 around the world.
कोरोना आ गया तो कोरोना ने काफी चीजें हमें सिखाई भी है। तो मैं कह रहा हूँ अगर आप कमजोर हो तो आपको बाद वाले पीटेंगे, कमजोर आपको कोरोना मारेगा, कमजोर आपको दूसरा वायरस मारेगा। तो भैया कमजोरी को सब परेशान करते हैं, तो अपने शरीर में ताकत बना लो, मजबूत हो जाओ, देसी भाषा में बोलते भैया तगड़े हो जाओ, स्ट्रॉन्ग हो जाओ। इसलिए जिंदगी में ना बस रुको मत, क्योंकि रस्सी पत्थर पे निशान कर सकते हैं, हम तो इंसान है ना, हम सब कुछ कर सकते हैं।
They all three of them. So that's the good news. Let us go to our study room and follow him. I climb the first floor. He climbed the first floor, second floor, third floor, fourth floor, and fifth floor. Catch the ear boy.
Congratulate all the doctors of our country, those who has been continuously working from front and taking the responsibility as front warriors.
भगवान नहीं इंसान है हम, सेवा के लिए कुर्बान है हम।
We are the doctors, we're always there for you. We are the doctors, we're always there for you.
In times of grave health emergencies like the current coronavirus pandemic, the doctors and health professionals of our country have always bravely taken up the mantle of being our frontline warriors to shower gratitude and offer unconditional support to the medical fraternity for their selfless service and sacrifice.
The effort of the entire healthcare community has been put to the test during the global pandemic, and that can be seen by all. We salute the entire community for leading the fight against corona from the front. Honorable Minister, we have been seen the way you are visiting hospital and affected area round the clock and your commitment.
Besides this, several other initiatives of your organization in the medical space have helped address the range of challenges faced by women and girls. Congratulations to all of you. I am positive that with the success you have achieved, so much of good work, you are all set to Medscape India.
सेवा के लिए कुर्बान है हम, सबके लिए दिल में जगह मानवता की पहचान है हम।
मेडस्केप इंडिया पिछले अनेक वर्षों से बच्चों के लिए, महिलाओं के लिए, उनके एम्पावरमेंट के लिए काम कर रही है। इस देश की बेटियों को बचाने की, इस देश के बच्चियों को बचाने की, और हम सब लोगों की कोशिश यही रहेगी कि इन बच्चियों की शिक्षा, उनकी सुरक्षा और उनकी समृद्धि ये हम सब लोग मेडस्केप इंडिया की ओर से करें।
For all of you who are at the Medscape National Award conference, women have to live with dignity in a given society. Sufficient work has to be done on men about their own evolution, their own civilization. It's very important. So, to uplift the women, it's very important we uplift the whole humanity.
It is the foundation day of Medscape India, Aryan Medical Educational Trust, completing 16 years of selfless service and also 6th year of Fit India movement and 3rd year of Doctors Day Fit India Conclave.
Let us also remember all those doctors and other healthcare workers who sacrifice their life saving patients' life.
We are the doctors, we're always there for you.
Dr. Sunita Dubey, in order to shed light on the campaign and chair the session.
भगवान नहीं इंसान है हम, सेवा के लिए कुर्बान है हम।
We are the doctors, we're always there for you.
All those doctors, who have done a great contribution in this campaign to save the girl child.
हम लोग लिटिल डॉक्टर्स कैंपेन लॉन्च कर रहे हैं। इसमें ये होगा हर बच्चे को ऐसे ट्रेन करेंगे जो एक्सपर्टाइज टीम है।
3, 2, 1. The Fit India movement is being launched, and we should be all fit and stay healthy. And we wish it success. We need your cooperation and help.
Doctors wanted to do best, and they do their best to protect the lives of people. वो अपनी तरफ से जो उनसे हो सकता है सबसे अच्छा करने की कोशिश करते हैं। जनता और डॉक्टरों के बीच का जो रिश्ता है वो सिर्फ बीमारी और उपचार का रिश्ता नहीं रहना चाहिए, एक कंपैशन का रिश्ता रहना चाहिए, एक दूसरे के लिए रिस्पेक्ट का रिश्ता होना चाहिए।
Government has taken many proactive measures with schemes at the center like Beti Bachao, Beti Padhao, Sukanya Samriddhi Yojana, Balika Samriddhi Yojana, CBSE Udan scheme, national scheme of incentive to girls for secondary education, Dhanalakshmi scheme, women empowerment scheme, to cite a few.
We have been working relentlessly on healthcare and Save the Girl Child, women empowerment, etc. It's lasts for more than a decade. And another theme also is fitness in Fit India.
I feel that a girl is everything in this world. That's what I think. And the girl should be given a lot of priority and see that she comes up.
मेडस्केप इंडिया का एक मिशन है सेव द गर्ल चाइल्ड, जिसके ऊपर कई सारे डॉक्टर अक्रॉस इंडिया इसमें काम कर रहे हैं।
Especially in areas such as health of the girl child, women empowerment, HIV awareness and rural health.
ना फिक्र करो, ना फिक्र करो।
जो एड्स पीड़ित होते हैं उनके साथ घुलने मिलने से या उनके साथ काम करने से एड्स नहीं लगता, और अपनी लाइफ में ऑलरेडी ये पीड़ा से गुजर रहे हैं, तो हम उनकी पीड़ा काफ़ी कुछ कम कर सकते हैं अगर हमें ये इन्फॉर्मेशन सही रही तो।
Having said that, your themes at Medscape India resonate very well with us at the Ayurveda group.
I want to congratulate Sunita Dubey ji. You've been doing a great work. Your social cause has been loved and appreciated by everybody. Your non-profit organization Medscape India is doing commendable work.
I'm extremely happy for receiving the Medscape National Award for encouraging the empowerment in sports, and also I'm extremely happy that they are working on Save the Girl Child and also women empowerment. I congratulate them for celebrating 5 years of Fit India initiative.
I must compliment all the members of We Doctors campaign and Medscape India, especially Dr. Sunita Dubey for extraordinary work in bringing development in health sector and helping our society in its truest sense.
All the healthcare warriors are symbols of the true spirit of our medical community. I would like to pay my condolence to all the doctors, paramedical and COVID who lost their life due to coronavirus.
We are the doctors, we're always there for you.
Congratulations to all the doctors Medscape Awards, and I truly support Save Girl Child movement by Medscape. Lots of love and best wishes.
And I feel that Dr. Sunita is doing a fabulous job, and you doctors also are doing a fabulous job, and I wish you all the best.
भगवान नहीं इंसान है हम, सेवा के लिए कुर्बान है हम।
I am thankful to all the COVID warriors for your unconditional support. I must compliment the members of We Doctors campaign and Medscape India.
सबके लिए दिल में जगह मानवता की पहचान है।
I would also take this opportunity to thank Dr. Sunita Dubey,
founder chairperson, and all the members of Medscape India.
करो ना फिक्र करो।
हर लम्हा हर घड़ी।
औरत की ताकत का क्या है कहना, वो बेटी है, वो माँ है, वो है बहना। औरत ही हमारे जिंदगी का चमकता हुआ है गहना। औरत की ताकत का क्या है कहना।
स्त्रियां पराया धन नहीं, स्त्रियां वो धन है जो हमेशा सघन रूप से परिवार को छाया देती है।
तुलसीदास ने भी कहा है कि अनुज बधू भगनी सुत नारी ये सब कन्या सम ये चारी, इन्हीं कुदृष्ट बिलोकई जोई, ताहि बधे कछु पाप न होई।
डे, करेज, ह्यूमैनिटी का प्रतीक हमारे वर्ल्ड वाइड डॉक्टर्स। वर्ल्ड में मेडिकल फ्रेटर्निटी और कॉमन मैन के दिलों को जोड़कर अनोखा काम करने वाले हमारे मेडस्केप इंडिया के ब्यूटीफुल ऑर्गेनाइजेशन को मैं सलाम करती हूँ। सो लेट्स with lots of pride on this wondrous occasion of the 5th Fit India Conclave by Medscape India, the Doctors' Day initiative, truly welcome one and all from deep within my heart and soul. As we always know, doctors are a true miracle of God. So, ladies and gentlemen, world class India, Medscape India. Health first class India, Medscape India. Medscape India is the first one to launch the Doctor's Anthem in the world in 2014. Completed 8 years of the Fit India movement. Anoki Pehel in girls' health and education, and so on. Medscape India working full on. And now, to everyone from across the world, please join us in thanking all the doctors and at the same time expressing our gratitude. May I please request you all to kindly join us for the inauguration ceremony, where we have with us our esteemed dignitaries who've joined us from across the world. Ladies and gentlemen, towards the beginning, to all the doctors who brighten up everyone's lives, we are truly thankful to you. A humble thanks from deep within our hearts for our honorable chief guests for this beautiful event. To our Honorable Minister of State for Tourism and Ports, Shipping and Waterways of India, may we please also welcome respected Shri Shripad Nayak Sir. A wholehearty welcome to you, dear sir. बहुत बहुत शुक्रिया यहाँ पर आप हमारे साथ हैं। तो आइए हम शुरुआत करते हैं with the गायत्री मंत्र। ओम भूर्भुवः स्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात्। Om. From darkness towards light, from ignorance towards knowledge, where the doctors create this beautiful space for all of us. We are truly thankful to each and every doctor. Thank you, Dr. Sunita Dubey from Medscape India, for allowing all of us to connect here with this beautiful inauguration ceremony. We are truly thankful. Thank you, doctors, once again for brightening up every individual's lives. It's an honor and privilege to welcome our honorable chief guest, who has a very close relation with the medical fraternity as the former Union Minister of Health, Family Welfare, and currently our Honorable Minister of State for Tourism and Ports, Shipping and Waterways of India. Please join me in welcoming respected Mr. Shripad Yaso Nayak sir. Namaste sir. Thank you so much.
Namaskar. I am delighted to know that Medscape India, Aryan Medical Education Trust, led by renowned radiologist Dr. Sunita Dubey, is celebrating the Doctors' Day and its 5th Fit India Conclave today. I compliment Medscape India for the excellent work it has been doing for last 16 years of humanitarian service and 8 years of the Fit India movement. The balloon release for the peace in Kashmir on Doctor Day will surely bring positivity and spread the message of unity and peace across India and the entire globe. This initiative, initiated by Medscape India in collaboration with the government of Health Services of Jammu and Kashmir, is indeed unique to Kashmir this year, and wish to provide the medical assistance to the poor and needy people of Kashmir. My good wishes to them on this notable cause. I wish to extend my wholehearted support to the project and conclave. Doctors' Day is an important day. Doctors play a critical role in our lives, not only to save the life but also prevent illness. During COVID, it was our brave doctor who helped prevent, spread and cure patients, thereby bringing down the mortality rate in our country and across the world. I take this opportunity of wishing all our doctors Happy Doctor Day. Good wishes also to Medscape India and Dr. Sunita Dubey for the good work she is doing. Thank you very much. Jai.
Thank you very much, dear sir, for your fatherly advice and the guidance. Humble thanks to you, Shri Shripad Nayak sir. Shukriya. Dear friends, Medscape India hopes to get the same cooperation and guidance in the future as well. Thank you, dear sir, once again. Ladies and gentlemen, Medscape India proudly welcomes a legendary personality, the one who started the medical college and hospital in the most rural area of Maharashtra, South Konkan. This visionary, compassionate leader, a former Chief Minister of Maharashtra, currently the Honorable Union Minister of Micro, Small and Medium Enterprises, may we please now kindly request respected Shri Narayan Rane sir to address everyone. We are truly honored by your great presence, dear sir. Thank you so much for being here with us.
डॉक्टर सुनीता दुबे जी, इस सम्मेलन में उपस्थित सभी डॉक्टर्स, अधिकारी और मीडिया के सभी सदस्यों, सबसे पहले मैं आप सभी को और पूरी डॉक्टर बिरादरी को 90वें डॉक्टर दिवस की बधाई देता हूं। अमेरिका में तो डॉक्टर दिवस 1933 से मनाया जा रहा है, जबकि भारत में इसकी शुरुआत 1991 में हुई है। हाल ही में पूरी दुनिया ने कोविड-19 महामारी के प्रकोप का सामना किया है। इस दौरान डॉक्टर ने अपनी जान जोखिम में डालकर जिस साहस और समर्पण भाव से मानव सेवा की है, वह योगदान हमारे लिए अतुलनीय है। मुझे बताया गया है कि डॉक्टर सुनीता जी की यह संस्था पिछले 16 सालों से स्वास्थ्य के क्षेत्र में कार्यरत है और इस वर्ष 5वां फिट इंडिया कॉन्क्लेव मनाने जा रही है। इस कॉन्क्लेव में रहने की शपथ दी जाएगी। स्वास्थ्य से संबंधित मामलों पर पैनल डिस्कशन होगा। फिट इंडिया अवार्ड 2022 भी लिए जाएंगे। मैं इस अवसर पर संस्था को सामाजिक और स्वास्थ्य के क्षेत्र में कार्य करने और डॉक्टर दिवस मनाने के लिए आप सभी को बधाई देता हूं। Thank you very much.
A humble thanks to Honorable Union Minister of Micro, Small and Medium Enterprises, Shri Narayan Rane sir. Your words and blessings are an inspiration for us always, and of course they will be forever. You are a patron for us. We truly want to thank you from deep within our hearts, Shri Narayan Rane sir. Thank you very much. Ladies and gentlemen, on this occasion of International Doctors' Day, we have a doctor who is leading the most progressive state of Goa. Doctor who has used his medical education as well as the political power for welfare for all strata of people. With a loud round of applause, may we please welcome our Honorable Chief Minister of Goa, Dr. Pramod Sawant sir. A wholehearty welcome to you, dear sir.
Namaskar. First of all, I would like to congratulate Medscape India as they are celebrating their 16th Foundation Day and 8th year of Fit India movement. Also my wishes to all the doctors on the occasion of Doctors' Day. I want to thank all the doctors and acknowledge their selfless services to mankind. I would like to appreciate Medscape India's inspirational contribution to the field of medicine with an aim to provide the best health services to people. This conclave is being held by the organization on national as well as the international platform. We should be proud that an Indian organization is bringing together the experts predetermining the competence of the existing healthcare in the nation and striving to improve its quality. The non-profit organization Medscape India has initiated various flagship campaigns focusing their energies on girl child, the women healthcare, the HIV awareness, etc. This organization is blessed with the voluntary doctors as well as the philanthropist people and who have dedicated themselves to the rightful cause. Amidst the background of the numerous challenges that the healthcare workers came across during the pandemic, the evolution of technology use in healthcare from the telemedicine to the patient-centric medicine services should be highlighted. This has increased the efficiency and patient engagement, which has brought about the paradigm shift in the provision of healthcare. The impact of COVID-19 was experienced worldwide. Now we have been made to realize the importance of healthy immune system. COVID-19 has also given us the reason to focus on providing skill-based training and opportunities to healthcare workers in order to enable them with a tool to adapt while managing the mass outbreak. The initiatives of Medscape in Jammu and Kashmir is commendable as they have extended affordable and accessible medical support to the poor and needy people of the state. Honorable Prime Minister Modi ji has prominently launched the various healthcare schemes which have extensively supported the healthcare in the country. Under the aegis of Ayushman Bharat, Modi ji introduced the various schemes like PMJAY that offers the medical cover up to 5 lakhs to beneficiaries. Other prominent schemes offered by the central government including National Mission Health Program, Rashtriya Swasthya Bima, etc. Goa has also implemented DDSSY, providing the free healthcare insurance up to 4 lakhs rupees per family. And institutions like Medscape should promote these facilities of the government that enable the provision of the essential healthcare throughout the country without providing to be a financial burden to our people. I'm sure the integrated topics describing the importance of fitness, mental health, incorporating innovations and technology in healthcare and promotion of the healthcare startups will be widely spoken about at the panel discussions. I once again congratulate and appreciate Medscape for their initiatives creating the positive impact on healthcare worldwide. Thank you once again.
Thank you so much, Dr. Pramod Sawant sir, our Honorable Chief Minister of Goa, for addressing all of us. You are a real idol of Medscape India, and we have absolutely no words to express our gratitude to you. Thank you very much once again. And now, ladies and gentlemen, here on the occasion of the International Doctors' Day, the 5th Fit India Conclave 2022, please join me in welcoming our visionary lady. Renowned MD radiologist, philanthropist, healthcare entrepreneur, versatile personality with high integrity, revolutionizing the healthcare sector with a fabulous philanthropic work as well as innovation. She's recognized on an international arena and has been blessed by our Honorable President of India, Shri Ramnath Kovind sir, our Honorable Past President of India, Shri Pranab Mukherjee sir, His Holiness Dalai Lama ji, our Bharat Ratna, the past President of India, Shri APJ Kalam sir, and many more dignitaries. Ladies and gentlemen, please put your hands together and let us all welcome the visionary lady, the best woman entrepreneur, the founder and chairperson of Medscape India, the one and only, the very affectionate, the very beautiful soul, Dr. Sunita Dubey Madam. Global Namaste, Sunita ma'am.
Namaste Sarvardhanam Pushtivardhanam means everybody should be healthy and prosperous. Today is a Doctor's Day and I wish all our doctors happy Doctor's Day. A very good afternoon and warm welcome on behalf of Medscape India family. Medscape India is the first organization to bring medical specialty in one platform and also with a collective conscience to work for the larger impact of the life to serve the society. Medscape India has been working as a volunteer organization with doctors and like-minded people who have been working on the Save the Girl Child, women empowerment and healthcare. Doctors' Day is very important and auspicious day for Medscape India because we completing 16 years of selfless service, 8 years of Fit India movement, 9 years of our Doctors' Anthem, same way Million Smile, women empowerment programs. Medscape National Award we are completing 11 years which is dedicated to the girl child and various other activity. In fact, the organ donation awareness which is done by our doctor through the sports. So now we are reaching to the stage where we are completing so many important days. So definitely that's why it becomes very auspicious. Today, 5th year of the Fit India Conclave, and last year we have started celebrating as a Immunity Day because of the immunity related disease we faced as a doctor, pandemic, and after that we realized we have to create awareness and empower the people with the goodness of the health to fight the future pandemic. With the help of committed doctor of the Medscape India, we are building bridge of cooperation and amongst the medical fraternity across the country to improve the overall healthcare ecosystem. With the help of committed member of the Medscape India, the entire healthcare system is seeing upgradation through technology for the rural and underprivileged, affordability for the one and all, and tech-enabled high-end and the medical device and guidance. We welcome our respected dignitary, Honorable Minister of Tourism and Port Shipping and Waterway of India, Shri Sripad Naik ji, Honorable Minister of Micro, Small and Medium Enterprises, Shri Aryan ji, Honorable Chief Minister of Goa, Dr. Pramod Sawant ji, and all the dignitary who has joined us today, and the doctors and friends and family and present guests today for Doctors' Day. Last year, we had unveiled the concept of the project Statue of Immunity, world's first scientific, technology-driven statue to fight the future pandemic by building inner immunity through the research and technology and innovation. The gigantic scale of Statue of Immunity and boundaryless multidisciplinary research center would not only help the provide the global visibility but also would help establish India's literally follow the dictum of Sarve Bhavantu Sukhinah Sarve Santu Niramah. We wish that our dream meets the vision of Honorable Prime Minister of India and wish to achieve it under his strong leadership and the unstinted support. Doctors are the torchbearer of good health. This program will bring positivity as it is the first unique program with the people of Kashmir along with the doctor from the Medscape India. Today's initiative has become the game changer in the current turbulent phase. The balloon release for the peace in the Kashmir helps in spreading positivity and message of unity and peace to entire globe for the first time in Valley of Heaven on the occasion of Doctors' Day today. Doctors from the Kashmir and various states have shown their solidarity today with us, which is the most heartwarming and touching for me as a being doctor. Medscape India, Aryan Medical Educational Trust has been undertaken various programs of volunteer based on philanthropic activity in health and medical sector for making our nation the best in world. This year, Medscape India has extended its reach to Kashmir and wishes to undertake medical care support to the poor and needy people of Kashmir. It is joint effort of Medscape India, doctors from Maharashtra, different state and doctors from the Kashmir. Today we also extend our support to our Kashmiri doctor friends. They can be trained for the critical care through our associated expert for improving critical care in Kashmir Hospital. In the beginning, as the pilot project in which we can train 11 doctors in Fortis Hospital in Delhi for the next 15 days that will enhance their capability of handling critical patients which they are currently unable to handle efficiently. Kashmir needs an escalator of the growth. Medscape India can be helping hand for the medical need. Our team of specialist doctors are willing to visit twice in a year in current scenario with the support or help to serve them for their medical surgeries and medical screening and the help whatever on their own. The policy set by the Government of India for the medical sector has been supported by all the doctors. This means government and medical fraternity needs to work together. The legal system of country needs to provide a safeguard to protect the doctor of our country before any assault or pandemic and many other such situations. One more very important subject I would like you all to notice. It is the cause of grave concern that Russian-Ukraine conflict has left our Indian medical student in a state of uncertainty. These doctors were undertaking graduation, post-graduation degree courses in Ukraine. They have returned back to India within an uncertain future. Medscape India, Aryan Medical Educational Trust has been providing facility to some of these students to continue their on-the-job training in own hospital, and many other hospital has been requested to take these students and engage them in the medical activity. We request government to look into this important issue to help our young talent and reduce the stress to our parents. Government should look at the creating medical cluster covering a population of more than 50,000 people at the village level, taluka and city level. I would like another suggestion. There is a need of create more skilling institution to bring in women as a paramedical and support staff in India. As a chairperson of Medscape India, I would like to assure government a continuous support of Team Medscape India and all policies of government for betterment of lives of our citizens. I am very grateful to Directorate of the Health Service, Dr. Mustaq, Director, Spokesperson, Dr. Mustaq, entire doctors team, especially Dr. Mahvish, Anil and Abhijit from the Kashmir. So I'm so proud all of you and the doctors from the Kashmir for today Balloon Festival, and also the panelist Secretariat of the Medscape India, Aryan Hospital for their dedication and support to this great cause. For the last 5.5 months since my last visit to Kashmir, many of my friends and families are silently working with me to support that. So I would like to thank all of them. Today's FITINDIA Doctors Conclave really covering a lot of important programs. One is the mass casualty and how to handle that, and that second is like how to handle the immunity and fight the future pandemic, whether it is related to the drug, how to prevent the drug, then how to ethical, how to take care of them, oral cancer, telestroke, how neurology brain stroke could be handled from the remotely. That is also discussed, and very interesting subject is going to cover today. The objective of the conclave is to bring together the expert in a various field to force upon the strength of its existing healthcare stakeholder for achieving the health for all mission. Today's world is prevention and immunity building is very, very important to overcome any illness. Today's event is being participated from the Dubai, USA, UK, Mumbai, Delhi, Punjab, Kashmir, Karnataka, and also the balloon release for the peace being organized at the Srinagar along with the doctor from the Srinagar. Let's make emotionally contented, happy and healthy India. Without taking much of your time, I would like to call upon dignitary to speak to and share his thought with us. Thank you. Jai Hind.
We're all extremely proud of you, Sunita Dubey, ma'am. Thank you for being a motivation for all those beautiful entrepreneurs and, of course, ladies across the world. Wow, this has been truly amazing. Immunity badao, zindagi badao. बहुत shukriya, Padma Shri Dr. Mukesh Batra sir. What an outstanding session. And of course, अब हम सब health में अपने best versions हो सकते हैं. Thank you very much once again, Padma Shri Dr. Mukesh Batra ji. तो आइए, we'll move on to our next session. And ladies and gentlemen, this session is on the quality of healthcare, medical challenges and solutions in Kashmir. खूबसूरती को हमने अक्सर भटकते हुए देखा है. हाँ, मैंने चांद अल्फाजों में कश्मीर को लिखा है. दुनिया में कहीं जन्नत है तो यही है, यही है, यही है, इसी कश्मीर में. कश्मीरियत का मतलब ही इंसानियत है. इसी कश्मीर के हेल्थ केयर के बारे में आज यहाँ पर हम इम्पोर्टेंट डिस्कशन करने जा रहे हैं. हमारा अगला सेशन is on the quality of healthcare, medical challenges and solutions in Kashmir. And to understand this concept, we have with us a world-class panelist with us. To chair the session, let me please welcome our renowned international economy policy veteran, an experienced corporate banker, active member of the Indian Merchant Chamber, FICCI, Indo-American Chamber. May we please give a loud round of applause for Mr. Atul Joshi ji. Namaste Atul sir, a wholehearty welcome to you sir. Ladies and gentlemen, this grand panel discussion is participated by brand personalities. The first one is an internationally acclaimed critical care physician with more than 2 decades of experience. TeleICU, Tele Medicine platform in North India, runs one of the largest ECMO programs in India since 2014. He is none other than critical care he-man, Dr. Sandeep Devan. Thank you, Dr. Sandeep Devan ji. Now, may we please kindly welcome the real voice of Kashmir, the spokesperson of the Directorate of Health Services of Kashmir and the former spokesperson of Doctors Association of Kashmir. A hearty welcome to Dr. Mushtaq Mir. Assalamu alaikum, Dr. Mushtaq Mir. Truly an honor to have you here with us, dear sir.
Ladies and gentlemen, welcome to this beautiful session on Kashmir, which is quality of healthcare, medical challenges and solutions in Kashmir. This is a Kashmir-focused discussion, and I have 2 dignitaries from our medical field. One is Dr. Mir Mushtaq. He is the spokesperson for the government and a very well-renowned person in the Kashmir government and anything and everything to do with the medical issues which the government is trying to put together and find solutions to. We have also with us Dr. Sandeep Devan. He doesn't need one introduction, one of the pioneers in this country when it comes to telemedicines, a person who has done so much of work, published so many books, and spread the knowledge about telemedicines, a lot of research-driven work, and not just in India. In several parts of the world, he is well known for introduction of the telemedicines, tele-ICUs, etc. So let's get on to our topic of today. Let me come to you, Dr. Mir, first. If you could give us a broad picture of the landscape of the infrastructure, medical and healthcare infrastructure in Kashmir, in terms of the hospitals, the clinics, the medical examination centers, or when it comes to the manpower per se, the doctors and the support staff, nurses, ward boys, etc. What is the current situation of the overall healthcare infrastructure in Kashmir? Over to you, Dr. Mir.
Thank you very much. Good evening, everyone. So I'm really glad that you have given me an opportunity to speak in this very august forum, and I'll try to be, very precise and the question you posed. I'll straight away come to it. In J&K UT, we have a system of healthcare as other parts of the country. We have two type of systems. One is the government-run system, and there is a parallel private-run system. But I'll call it, fortunately, we have a predominantly government-based services here. If I say 95% of the healthcare is being taken care by the state, so I'll not be wrong in that presumption, because the presence of private sector is almost negligible. So second is the government sector again is divided. We have the rural setup, which comes under the Directorate of Health Services, Jammu and Kashmir. And then we have the tertiary care system, the medical colleges, the Sher-e Kashmir Institute of Medical Sciences here, which is a tertiary care institution. We have two super specialty hospitals, one in Jammu, one in Srinagar. We have two upcoming AIMS which are coming up. Jammu one is already almost in the finishing lines, and the other one is being done at Srinagar, Avantipura exact. Then we have a robust mechanism of rural health that comprises of the district hospitals, sub-district hospitals, community health centers, PHCs, sub-centers. It is in every nook and corner of the valley, and everything is covered by the government. It's true that ours is a very hilly state. Geographically, we are a very different state from the rest of the country. We have a hilly terrains, and the weather conditions, as you know, 6 months there's winter, 6 months there are different seasons which are there. So there are difficulties, in terms of providing healthcare. But the fact is that the state is doing, the UT is doing tremendously well. If you see the recent data, if you see the NFHS data, which is just being out a few days, the infant mortality rate of J&K is 16.3 versus 35.2 of the country. You have a neonatal mortality rate of 9.8 versus 24.9 in the rest of the country. You have a sex ratio of 976 versus 929 to the rest of the country. You have under 5 mortality rate of 18.5 to 41.9 in the country. So if we see the health indicators, we are doing extremely good, and that's very heartening. So I must compliment the UT administration, the government, which is providing all the basic facilities of healthcare to the people. And we must at the same time appreciate the ground line workers, the doctors, the paramedical staff, who are doing extremely great job, working in very difficult terrains, very difficult areas. And above all, you all know that we have seen the conflict from last 20, 30 years as well, which is also playing its own part. I hope I'm audible.
Yes, please. So it's really encouraging to see, Dr. Mir, what you mentioned, that it's a fantastic structure which already exists, not just in the large cities, but also in the district level as well as at the tertiary level, which is going over to the villages. And that is something which is a fantastic infrastructure to start off with. Besides, you also mentioned about the 2 AIMS coming up. So again, a very encouraging news that you just mentioned. Let me turn to you, Dr. Sandeep, and ask you about the whole. Dr. Sandeep, I wanted to come to you and ask you about, while you have the physical infrastructure in place in terms of the hospitals, etc., there is a need to feed these institutions with quality of doctors and quality of sub-staff all the time. So if you could just talk about the kind of medical educational infrastructure, and what is it that can be done to improvise further in terms of, let's say, whether it is medical faculty that teaches the students, or the presence of medical colleges in different parts of J&K, or any other suggestions that you may have. Over to you, Dr. Sandeep.
Hi, I'm audible?
Yes, sir. Absolutely.
I'm sorry for the hiccup in between for a few seconds. As Dr. Mir has already told, there's a lot of infrastructure upgradation that is happening in Kashmir, whether in the form of All India Institute in Jammu and or Srinagar. And we all know Sher-e-Kashmir Institute has been a renowned medical institute for so many years now. And so is the Medical College Jammu. But I think the need is much more than that. See, it's not only about the quantity of the doctors. What we are seeing as a practicing critical care physician is that the quality of doctor is equally important. See, ultimately, all the doctors that are churning out of the medical colleges have to treat patients. Now, what is happening is, I think it is time that we give skill-based knowledge rather than a degree-based knowledge to our students. I'll tell you where the whole world is moving towards medical education. What is happening is that whatever new medical colleges are coming, we have seen that the patient load in those medical colleges right now is extremely low. We are not able to get enough faculty to teach the students. And this is a problem which is very well documented. And the problem is that because the training suffers, that's why the doctors which are coming out have not had enough exposure to patient clinical situations once they are coming out of the medical school. So what has come as a solution is called as simulation-based training. If you are aware of military and aviation industry, the military and aviation always train on the simulators. You don't go into war every year. Similarly, you can't have a billion-dollar aircraft and just start flying it without having enough knowledge. So that is why the medical education, particularly emergencies, is now being compared to the same level of training as is done in aviation. So all across the world, because there's a lack of patients, and plus we all trained in 80s when we were practicing on the patients. At this point of time, we cannot treat patients like guinea pigs. So there are enough scenarios and simulators available which can give exposure to the students. I'll give an example. Then NMC has given guidelines that simulation-based training is part of the curriculum, but it's a very small part of simulation which has started. But I think we need to move to an area where we can teach emergency management to our MBA students, to our MD students on how to manage certain scenarios. I'll give you an example. If somebody comes with a respiratory failure, how do you identify the cause? How do you treat it? How do you actually act under stressful environment is completely different than what you read in a book. For our medical education, we always used to cram how to treat an asthma. I'm sure all of you have done it in your medical college. But when it comes to actual treatment of acute exacerbative asthma, we fail completely. At that time, you can't remember a book. But if you have done that scenario in your life before, you will never miss it. I'll give you my example. I was trained in simulation in Singapore. I was given a scenario of thyroid, post-thyroid surgery, patient developing stridor. And thyroid hematoma normally happens. You have to take out the hematoma in a simulator and the stridor goes off. Once you fail in that scenario, you will never forget it for the rest of your life. So that is why I think, as Dr. Mir is saying, the government is very focused on increasing the number of colleges, which is the right strategy. But I think we should always move on to giving practical-based training to our students, which at this point of time is lacking when we compare with the best healthcare systems like Singapore or US.
So point taken, doctor, point taken. We have the physical infrastructure. Now we need two things. You mentioned key two takeaways. One is, of course, the qualitative faculty being present for teaching the students. And second is the use of the high-end, technologically high-end equipment such as simulators and the IT-enabled usage of the same into bringing it into the curriculum for the students of J&K. Let me turn to you, Dr. Mir, now. Let's talk about on the ground, what is the reality when it comes to health issues, specifically the health issues. As you know, Medscape is about helping out the people at the grassroots level. So if I may ask you, Dr. Mir, what are the three key diseases that you see among women and children in Kashmir? Over to you, Dr. Mir.
Yes, before coming to that, I'll just like to respond to what my fellow panelists has pointed out. It's a very pertinent thing he has raised, is about the trainings and the quality of the trainings. That is what we also feel in today's age, that what the products we're getting in from medical schools are not fully furnished. It's not fully finished products. There's a lack of practical training. I do agree 100% with it. We might have very good doctors who have academically scored very high percentage of marks. They might have gone a lot of post-graduations for specialties. But when it comes to the practicality and seeing handling an emergency situations, we find most of them lacking. So in that scenario, what we had suggested once, since I was once a part of the Doctors Association also here, we had suggested that in-house trainings for doctors. See, we have to focus for primary care physicians. Unfortunately, the era of post-graduations for specializations, we have forgotten the role of primary care physicians, which is the most important role one can play in the healthcare scenario of any particular place, be it Kashmir, anywhere, is a primary care physician, a first contact with the patient. If your first contact is not competent enough, you will not have a good, robust healthcare system, and the patient will land up in problems. So the focus has to be on primary care setup. If our primary care setup does well, secondary care will automatically do well, and the tertiary care will obviously do well. So what I would like to say is that we need to train our medical officers, those who are particularly MBBS doctors. They need to be trained in different fields. They need to be given specialized trainings, particularly in like the emerging situation. What we see, most of the people lose their lives in emergency situations. So we have to broaden the base of emergency medical treatments. So we need to create more emergency physicians. We need to create more emergency medical officers who will be able to handle casualties. The fact of the matter is that since we have a lot of postgraduates now coming out, so if you see, which happens in our part of the world as well, that casualty is being managed by a medical officer who is actually an ophthalmologist. A casualty is being managed by a medical officer who is actually an ENT specialist. So because they're actually being appointed on medical officer posts, but they are actually different branches. So what we want to say is, what I want to convey is that we need to create emergency specialists as well. Good number of emergency specialists, I think, throughout the country, not only in Kashmir. So because it's a pan-India problem, we lack.
Maybe Dr. Mir, what we can do is, it's a very good point that you've raised. Let's use Medscape as a platform, and let's initiate a proposal that there should be a student exchange program once the students complete their MBBS across different government hospitals across the country, so that they gain wealth of knowledge, especially in case of emergencies, and then come back and work in their home state. That could be one very good suggestion to exchange the students post their MBBS. We may continue. Sorry, I just thought that is one important thing which we can probably use Medscape platform for.
So yes, second point for improvement, if we say, is that we need to take care of the doctors as well, particularly because it's a Doctors' Day where so we have to see the needs of the doctors are fulfilled. They are being provided a good environment to work. What is happening as a pan-India scenario nowadays, that doctors don't feel comfortable at their workplaces. A lot of people coming and harassing doctors, then there's threats, there are some physical beatings. And we need to take it very, very seriously, because if the doctor is not comfortable himself, he cannot comfort others. So we need to, government needs to rise to the occasion and make strict laws that nobody should be allowed to take the law in their own hands, whosoever it may be. And nobody should accept it in medical field. Because doctor, at the end of the day, tries his level best to save a patient, and we should get that faith back in them, and we should back them, and we should not,
Point taken. Point taken, Dr. B. Point taken. So, sir, if I may request you to come to the question on the health issues with women and children in Kashmir, please.
Hey, women particularly, yes. I'm sorry to, I just wanted to make
No, but it's a very well made points, Dr. Mir, and we will use Medscape platform to make those suggestions. But given the time constraint, I thought
what you said the issues. I think generally what are the issues common to other places are common here as well. If you see in general OPDs, we have a lot of diabetes. You'll be surprised to see Kashmir has the highest number of diabetic patients. Hypothyroidism very common. Then we have hypertension as again a very prominent figures among the top notched diseases. Anemia patients in rural India, you see a lot of people who are anemic. So I think this is the mostly the female folk comes with. And then in children again, you have though we don't get a lot of malnutrition patients, but the general problems which are being faced other places in India are commonly faced.
Dr. Mir, you are mute.
Sorry, I lost you somewhere.
Yeah. No. Now you are on. For in between, we lost you in terms of you went mute for a brief few seconds. So you mentioned was about the impact of anemia, anemic nature of people. They suffer from anemia. That is what you mentioned the last. Yes, Dr. B. Yeah.
Yeah, sorry.
Yeah, now you are on. Yes.
Yes. There was some problem in between. So I think these are the problems which usually the people face here. But rest, I think.
What about children, Dr. Mir? What are the key issues that the children face? I mean, from pediatric perspective. Dr. Mir, the question also is to you, what kind of issues do children face? Dr. Mir, the question to you is, also about the children, as to, what are the key, let's say, 3 top diseases that you see from pediatric perspective?
If we talk nowadays, we used to have a lot of upper respiratory tract infections, and post-COVID, the schools have started opening up. So a lot of pediatrics are flooded with the patients having upper respiratory tract infection, fever, cough, and then seasonal flus and all flu you always see in the patient children. Fortunately, I think we don't find a lot of PEM cases. Protein energy malnutrition cases are not that much. That way the people are taking good food and care of their kids. The rest, I think, the commonly associated disorders with the children are prevalent here as well. So, but in this today's environment, we have a lot of seasonal flus and fever, cough in children, which are routinely out there.
Which are more seasonal, fine. Let me turn to you, Dr. Sandeep. From your perspective, what are the top 3 diseases that we should look at when it comes to the men part? Over to you, Dr. Sandeep. Dr. Sandeep.
Hello, I'm audible?
Yes, sir. Yes, sir.
Yeah, so our data, Dr. Joshi, shows that the most common disease that we have encountered in in the rural parts of the country is hypertension, the first comorbidity that we have seen in males. And let me tell you, if you remember your park and park days, it is absolutely correct. A lot of time we are actually, patients are coming with complaints of dizziness or vertigo, or they don't even know that they have been hypertensive, and by the time we get to know, they already have microalbuminuria or some kind of a kidney problem which has already set in. So I think hypertension is a big major comorbidities in men. Then, as Dr. Mir had says, diabetes. We know India is the diabetes capital of the world, and given our change of lifestyle and our change in eating habits, diabetes is the second most common comorbidity that we are seeing. The third that we are seeing is the coronary artery disease. You know, if you look at the data internationally and India, coronary artery disease actually strikes Indian men about 10 years earlier as compared to European or the other parts of the world. So that's why it's very important that we actively keep on looking for coronary artery disease. A lot of time patients are coming with unstable angina and they're taking it as a gastritis or some kind of, just mild gas and all that, and they have bad coronary artery disease when we actually evaluate them. So I'll give you an example. We are running telemedicine OPD for 168 leprosy centers in the country, all leprosy colonies. And if there's no way you can imagine that leprosy colonies comorbidities will be same with the comorbidities in metro cities. But the fact is they are. So we know that the leprosy patients are malnourished. They are one of the most I would say, privileged population in the country. They have negligible access to healthcare. And still, when we started doing telehealth for these leprosy colonies in 168 colonies in India, we found that the comorbidities in there are the same as the comorbidities that we have in the Indian men in the urban population. So that means we have always believed that these problems are related to overnourished men. I don't completely agree with this theory, because now, having worked into the rural part and running e-clinics, we know that there also the problems are more or less the same as they are in this country. So I think these are the three major comorbidities disease that we encounter.
Let me now turn to the solution thinking part of it. Dr. Mir, coming to you, having discussed the issues that we see from medical perspective, whether it is physical infrastructure or it is education institution related, training related, or on the ground what we experience in terms of the most prevalent diseases. What are the steps that you think the government should take so that these issues can be addressed? Maybe not in a complete manner, it's a kind of a phased effort. If you look at several countries which are smaller, let's say UAE, or it is Mauritius or Madagascar, or some of these small island countries also are not able to come up to the best of the medical facilities in a short span of time. So from the limited perspective of Jammu and Kashmir, UT, if you could just broadly talk about what are the next steps of solutions that we can bring so that the health can be improved, the healthcare infrastructure can be improved, and the people of J&K can be helped. Over to you, Dr. Mir.
Thank you very much. Let me say our focus has to be on three major branches, what I believe, so that the people will be benefited. One is maternal side, child care, what we say MCH, maternal and child health, and trauma. These are the three important things I believe the government has to look into it and give priority to it. Once we call up maternity child health, we have a lot of specialists available in the field, but unfortunately, say the doctor goes to a particular post. Suppose in a particular district there are 10 PHCs or sub-district hospitals. You have 10 gynecologists, one each going to each hospital. But technically speaking, medicine being a teamwork, one gynecologist at a particular place will not be able to deliver. So what we had suggested, and our Director of Health Service Kashmir, particularly Dr. Mushtaq Ahmed Rathar, he came with a very out-of-box solution of pooling these doctors of multiple specialties, pooling them at one particular place, say in a district hospital. If we have 10 gynecologists in a district, we can pool them, keep them one group of these 7 doctors at one place, so that at least one center in a district runs 24/7, rather than 10 centers having 10-4 facility. You can have a 10-4 facility in those centers, but at least one center should be functional round the clock. So there was a recent fire in the Bone and Joint Hospital. So Director of Health Kashmir, Dr. Mushtaq Ahmed Rathar, came with a very innovative idea of starting 5 places, orthopedic services 24/7, due to which the tertiary care hospital, the Bone and Joint Hospital here in GMC Srinagar, which got burned, the people got respite because we started services in the rural area. So likewise, what I mean to say is that if we pool the resources, we join the doctors together, pool them at one place, give them the facilities, have the anesthetists pooled at one place, have the surgeons pooled at one place, at least in a particular area, at one district or sub-district hospital, we can surely say we are going to give 24/7 services to them. With the result, the referral rates for tertiary care will decrease, and the tertiary care will properly function. Otherwise, what happens is that every patient is referred to the tertiary care, and then finally the tertiary care suffers and it starts functioning as a secondary care place. So that's one. Second is, since we have in J&K particularly, we have a very hilly terrain, like the areas like Gurez, Tangdar, LOC areas, where it is very difficult for the people to go.
Hello.
Yes, Dr.
I couldn't hear later part of Dr. Meer's.
Dr. Meer,
can I continue?
Yeah, please. The second point you were saying, the hilly area, the hilly terrain, yes.
Yeah, hilly terrain. So again, there's a problem. Doctors are reluctant to go to those areas because of the difficulties they face. But the irony is that,
Oh, you muted again. Just the mute, yeah. Hello, Dr. Meer?
Yeah. Sorry, actually, since I'm calling from mobile, I'm attending from mobile, some calls are coming in between. So that's creating some sort of problem.
No problem.
So
No problem.
I'll briefly try to finish it off. So what I'm telling you is that we have a different terrains, we have LOC areas, so we have to attract the doctors and paramedics to go to that places. We need to incentivize them. Because unless you don't incentivize them, and we need to have a rotational policy. Because if one doctor goes to a hilly area and he believes that for 5 years I'm not going to come back from that place, he is reluctant to join, he leaves, there's a brain drain, he goes to some other part of the country or even outside the country. So to motivate them to go to such places, we need to incentivize them. We need to give them better facilities in terms of the residential facilities. We need to give them academic incentives, like somebody, if goes to a rural area for 5 years, I mean a difficult area, we can give him a reservation of 30% or 40% in the post-graduation. So likewise, you should have certain out-of-box ways where we can attract doctors and paramedics to go to these places. And more importantly, those doctors who come from those areas, who come on those certificates, need to serve those areas.
Very well made points, Dr. Mee. Very well made points. Let me come to you, Dr. Sandeep. Since we are running short on time, let me just ask you, there are two things that we were talking about. One, of course, is the difficult terrain of Kashmir and how it becomes difficult for people to access medical services, lack of doctors, etc. how could we bring the technology that you have already been working with, whether it is telemedicine or TeleICU, to help the people of Kashmir? Over to you, Dr. Sandeep.
Thank you, Dr. Joshi. So just to start comment, as you said, Dr. Mir, we can actually train a lot. Just to add on the previous discussion, we can train your junior doctors in our critical care facility at Fortis Gurgaon, because we have a simulation training there. Plus, we are already training students from the states of Madhya Pradesh, Chhattisgarh, Nagaland, and Haryana, who are already coming to our Fortis critical care facility for training in emergency and critical care. And they work with us in our ICU. So then when they go back, they are able to manage most of the emergencies. Just to tell, that can be a very good practical option that can be given to your junior doctors also. As you rightly said, primary physician needs to take the onus. Coming to your second point, Dr. Atul, I think, can we utilize digitalization? Yes, of course. See, we all know that the best, as Dr. Mir was saying, the best is to have a doctor, a fully trained doctor on the ground. But there's a lot of gap between what is best and what is available, isn't it? So if we can find out a mechanism, if the doctor cannot reach the patient, if we can find a mechanism where the patient's data can reach the doctor, the system can be easily run beautifully. Let me give you an example. Suppose any emergency in Jammu and Kashmir, in the remotest part, gets connected to our command center. Right now, I'm sitting in my command center. And if you'll permit, I might show you a snapshot. In the command center, there's a team of critical care physicians or emergency physicians, like Dr. Mir. If you have a pulmonologist or a cardiologist or a senior physician, now, if you have dedicated it to one area, the other areas will feed the shortcomings. But if you can find out a way of connecting the hilly areas to, say, a Srinagar or Sher Kashmir Institute or any area, then the physician from there only can actually monitor these patients and give the advice. Now, this is not something new. It's been there. We have been doing it for 12 years now. It's been there in India. And this actually is the best next alternative, Dr. Mir. I'm not saying this is the best way, because ultimately the best is to have a trained specialist on the floor inside in the emergency or in the OPD. But if that's not available, the best possible is to have him online. Now, what is the benefit? Suppose you have a 6-bedded emergency or a 10-bedded emergency. If you recruit a specialist, now the specialist is only limited to those 6 beds. But if you are able to put a specialist in a centralized area, and through the technology, he can access the data, he can see the patient, he can actually, rather than taking care of 6 emergency beds, our data shows he can take care of 40 to 50 emergency beds. So that is it is not only bringing in the good quality to the hilly areas, but it's also giving in a good quality, cost-effective care. Because if we have to put up a specialist every time in every area, the cost is going to be huge. And we know that government has now given very good incentives to the doctors who want to go into areas of need. Isn't it? So that is one model which we have been doing for last so many years. And it not only takes care of the emergencies, it also takes care of the OPDs, it also takes care of the super specialty consults. In a way, it takes care of the holistic healthcare needs. Now, we can run a dialysis unit also through the same model. We can run an emergency also. And obviously, we can run e-clinics or the OPDs also. It is the only thing that you need is a good connectivity between the spoke and the hub area. And the whole system depends on the alerts coming on to. So if you have an emergency which is connecting to say Srinagar, and the alerts of the patient start coming, the moment you hook the patient to the emergency monitor, the specialist at the command center will get to know what is the saturation, what is the blood pressure, what is the heart rate, and any fluctuations in those get in the form of alarms. So the specialist sitting there only can help multiple areas. So this is a proven model. It's been working fine. A lot of data has been generated from India, as I told you. I think that should be the way forward, and it will be of great help in trauma particularly, Because in trauma, not everybody will be able to reach Srinagar, you know. And we know in the trauma, pre-hospital care is also equally important. What you do in the community health center or a primary health center will define whether the patient will die or live, not what when they reach the medical college. So I think trauma, as is your priority, it can go a long way. Through the same model, we can run neonatal ICUs also, Dr. B. So even NICUs, SNCUs can be easily run. So a single pediatrician at the CHC can run multiple SNCUs through the same model. And obviously maternal mortality can be further reduced. So I think these ideas, we have to be innovative. As you've already taken one innovative step, another one can also be of I would say, help in the same direction.
Thank you, Dr. Sandeep. So generous of you to have made that offer, and I'm sure Dr. Mir will take it up. My suggestion would be maybe look at a particular district and try to see if we can work together. That district of J&K along with Fortis Hospital with your help, Dr. Sandeep, and see if that works. Then it's easier to replicate that across different districts or different command centers versus the hubs and the spoke. So it's a fantastic suggestion. I think we are running short on time, so we won't be able to dwell further into this. But thank you so much. Both of you are so full of energy and so many suggestions have come. I'm sure Medscape will take it up and try to take the next steps to kind of alleviate the issues that we are facing in terms of healthcare and healthcare infrastructure. Thank you so much for being with us. Thank you, Dr. Mir. Thank you, Dr. Sandeep.
In our 21st century, this naturally divine heaven called Kashmir will have established access to world-class healthcare. And that's the loud and clear message from our panel on this day of International Doctors' Day. Our humble thanks to Dr. Mushtaq Mir, Dr. Sandeep Devan, and our chairperson, Mr. Atul Joshi. Humble thanks to you all.
Good afternoon, everyone. Today is Doctors' Day. As you know, 1st July is commemorated throughout the country as Doctors' Day. On the birth anniversary of Dr. T.C. Roy, who was a great physician and also the Chief Minister of West Bengal from 1948 to 1962. On his memory, this day is being celebrated throughout the country as a Thanksgiving Day for the services rendered by the doctors. So today we have gathered here at MMC Nurbagh on the directions of Director Health Service Kashmir to commemorate Doctors' Day. I welcome Dr. Nishad, Assistant Director Health Service Kashmir, Dr. Jahazeb, Deputy Director Health Service Kashmir, CMO, Senator Dr. GM, and we'll be releasing these balloons for the peace and prosperity of the entire country and Kashmir in particular, and to remember the services of doctors. I request Dr. Nishad ma'am, Dr. Jahazeb and Dr. Jamil Ahmad Meet to jointly release the balloons and all others to applaud them. Thank you very much.
And now, we have a session on the explosion of mass casualties and solution optimize. Explosion, ambush, warfare, firing, landslide, bridge collapse, and alike tragic incidences which lead to mass casualties. Whom to save, how to save, code red, code grey, and so many protocols during the mass casualties. It's completely chaos if not handled carefully, because every second counts, and every life too. So let's understand the subject from the person who understood this concept and who has witnessed this many times in his life. My dear lovely friends, Sena Medal Gallantry Award winner, our Indian Army veteran, representing the Indian Army King, a big salute and a very warm welcome to Brigadier Rati Raman Singh Ji. This is the session on the explosion of mass casualties and solution optimize. We welcome you, Brigadier Sir. Jai Hind to you, sir. Thank you.
I wish to congratulate Medscape India, AMET and Dr. Sunita Dubey on successful journey of 16 years of Medscape India and 8 years of Fit India campaign. I also congratulate and convey my best wishes to entire team Medscape India Kashmir on Doctor's Day, that is 1st of July. Dr. Sunita Dubey, Dr. Neeraj Dubey and team Medscape India has worked tirelessly to help poor and needy in the field of medicine and healthcare sector. Kashmir has a bright future ahead. There is a lot of care still needed for poor and needy in far-flung areas where medical healthcare has not been able to reach as much as it is available in the cities. Team Kashmir Medscape India wishes to provide help to those who need it the most. Medscape India has carried out many successful campaigns to help poor and needy. Some of these campaigns are Save Girl Child campaign, Million Smile Women Empowerment campaign, Fit India movement and HIV awareness program. Preventive healthcare medical camps, rural health program in different states, flood relief and medical aid in Assam, TeleICU and medical support during COVID-19. Medscape India is also working on technology-driven research and development-based project called Statue of Immunity. Medscape India is also providing on-the-job practical training to medical students who have left their medical degree course midway in Ukraine. This ongoing Russian-Ukraine crisis signals us to be better prepared in case of a situation wherein we may face mass casualties, maybe because of natural calamities or due to man-made disasters. Mass casualty management is an important aspect which must be addressed for both medical and non-medical persons as well. Whenever number of casualties exceed the normal existing medical resources, it is an indication of mass casualties. This surge in casualties must be identified and we all should have a knowledge and preparations to handle this surge. Training of manpower and dual use of resources can have future-ready preparations for this surge. The surge plan must be able to identify levels of preparations required. Disaster Management Act of 2005 has all the mechanisms to handle such disasters. At international level, we already have UN OCHA, that is United Nations Office for Coordination of Humanitarian Affairs, catering for any calamity. Prime Minister Sri Narendra Modi ji also working on International Disaster Relief Fund. Use of new technology, artificial intelligence, robotic science, satellite and drone technology are playing important part in handling disaster management. At national level also, apart from nodal ministries, Ministry of Home Affairs is handling such issues. Government bodies like National Crisis Management Committee, National Disaster Management Authority and National Disaster Response Force already working as per disaster management plans through various disaster management centers and administrative training institutes. At state level also, we have State Disaster Management Authority and State Emergency Response Mechanism to handle L1 and L2 category of disasters. The Mass Casualty Incident MCI needs tremendous amount of coordination among all stakeholders, may it be government bodies, may it be non-government organizations, common man, or the people who are affected most by the disaster. The inhospitable and difficult terrain poses additional problems. Climatic and weather conditions can severely hamper our efforts, especially in Kashmir. The principle of triage for casualty categorization must be practiced for green, yellow, red and black category of casualties. Some of the very important aspects which need deliberate efforts are before incident preparations, resource mapping, dual use of resources, buildings, road, infrastructure must be able to take on surge with minimum changes. Forecasting and reporting in correct manner can help better preparation. Communication must be proper for better management of resources, recording of details, handling of aid received, redistribution and preservation of resources, etc. etc. The principle of golden hour must be used for saving life. Life-saving medicine, first aid kit availability to maximum persons will help in this regard. Psychological conditioning pre, during and post disaster will facilitate smooth and effective casualty management. In case of radiations, chemical, nuclear, biological casualties, decontamination of individual buildings, vehicles, etc. must be practiced. These casualties will be kept separately. Staging areas, relief camps, locations and access to these locations, these facilities through road, train, air means must be practiced and rehearsed. Finally, in summing up the awareness effort, I will say a little awareness in management of mass casualties can really bring synergy in effort, and it can be a very fruitful exercise in saving precious human lives. I once again congratulate Dr. Sunita Dubey and Team Medscape India MEAT for putting in extraordinary efforts to help poor and needy. Wishing you all happy Doctors' Day. Thank you very much.
Life is precious and time is the key. Message is loud and clear. India is heading to save every life. Every life counts in mass casualties. Thank you so much, Brigadier Ratim Raman Singh, sir. India salutes you and our Indian soldiers as well. Jai Hind, Jai Hind, Jai Hind. Hell. Let's move ahead to the immunity and its role in the pandemic situation. We all know the Statue of Liberty, the Statue of Unity, and now Medscape India is the first one to launch the unique idea of the Statue of Immunity. That's the best gift to the world, fighting many pandemics. So let's understand immunity. In our next session, immunity and its role in the pandemic situation. This session shall be chaired by our special personality. She is MCH pediatric surgeon, educating medical students for more than 28 years in well-known institutes across the nation, a philosopher, national international award winner, the one and only. May we please welcome Dr. Mrs. Shashmita Bhatnagar. A wholehearty welcome to you, Dr. Mrs. Shashmita ji. Thank you. Immunity message will be spread by one more important panelist, the doctor who's been serving approximately 50 years with his internal medicine expertise, who served the poorest poor patients to the presidents of India, the world-class physicians, जिनके द्वार से कोई कभी न गया खाली. May we please welcome Dr. Mohsin Wali. Thank you very much, Dr. Mohsin ji, for being here with us. And our immunity team is supported by MD microbiologist, a doctor who is well versed with many viruses attacking immunity in immunosuppressive disorders. Let's welcome immunity brainy doctor from Mumbai, Dr. Naina Avinash Ingole ji. We welcome you, Dr. Naina Avinash ji. Shukriya.
A very good afternoon to all of y'all here today for this wonderful session on approach to immunity in our post-pandemic world and its role in our day-to-day life. So COVID pandemic has really taught us the role of immunity, because we were aware of it even before that, but it was kind of a neglected area. Today, we will touch upon this subject, as all of us who are lucky enough to have been reasonably having good enough immunity are surviving, and we have the opportunity to discuss and to take action appropriately, and also to pass on the message to all the youngsters who are struggling with their diet and immunity. So nevertheless, we need to upgrade the quality of our lives as well. And there are so many pathogens and pollutants around us 24/7. So I have a great pleasure and an honor to invite esteemed panelist, Dr. Mohsin Wali. He is an Indian cardiologist. He is a former honorary physician to Dr. R. Venkatraman, as well as to Shankar Dayal Sharma ji, and the serving physician to Pranav Mukherjee ji. Till his lifetime, his first assignment as a physician to the President of India was with R. Venkatraman at the age of 43 years, making him the youngest physician to serve an Indian president. He is the only physician to have served 3 presidents of India. The government of India awarded him the 4th highest civilian honor of the Padma Shri in 2007 for his contributions to Indian medicine. He has been a winner of many awards and citations. Welcome, Dr. Mohsin Wali.
Thank you, ma'am, for your kind words. Happy Doctor's Day.
Happy Doctor's Day to all. Dr. Naina Avinash Ingole is our another esteemed panelist. She is an additional professor in microbiology department of TN Medical College and BYL Nair Hospital, Mumbai. She is the Deputy Lab Director, Molecular Diagnostic and Reference Lab of Kasturba Hospital for Infectious Diseases. Welcome, Dr. Naina.
Thank you so much, and happy Doctor's Day to all of you.
It's happy Dr. Day again. So my first question goes to Dr. Wali. Dr. Wali, kindly provide a broad perspective of the role of immunity in our day-to-day lives.
Thank you, Sushmita ji. Immunity is defense. It's like defense ministry. And before that, I would wish Medscape India and Aryan Medical and Charitable Trust its completion of 16th year, 16th Foundation Day, and 8th Fit India movement, 8th year. And your hero of the immunity, I can say, our Dr. Saab, who is working day and night to create a healthy nation. So I wish the whole team of your group and to especially your group leader a warm wishes on Happy Doctor's Day. And what can I say in the beginning, that we have learned so much about this word immunity as a common man. This word has reached to a common man. Previously, this word was not spoken by a common man in our day-to-day practice. And as I rightly said, it's a mechanism of defense in the body which pre-exists in a mature full-term child, and then the child carries this immunity throughout its life, and it keeps augmenting itself. The more injuries we get, as you said, from the environmental factors and the other pollutants, as you very rightly said, these days they have become very relevant. So the immune system every day learns to fight it better to save our lives. So it is like a gunman in our body, a security system, and this security system has some rules and regulations to follow. And when the security system fails to follow its rules and it starts de-recognizing the body tissues and cells, I think that starts with the problem, and that we called is autoimmune diseases, what we will be discussing today as a burning topic. And Sunita Dubey ji is very fond of immunity, as I said in the beginning, and she has a novel concept of making a statue of immunity, for which I have congratulated her already. And we, through this program also as a doctor's appeal to the government of India, that this concept of a statue of immunity should be brought forward for the benefit of the common man who is now very much sensitized about the word immunity. And I have told just now that this immunity means that our defense mechanism, and autoimmunity means when the own cells start eating our own cells, in a layman's language. And the immunity is basically cellular or humoral, or we have identified another type of immunity lately, which is subject to very much genetic mutations. But when we talk of cells, these are B cells. They give us immunoglobulins, which are very commonly talked, and T cells, which give us fighter cells, that sometimes we call them T helper cells. And then they have also been classified as T suppressor cells. Dr. Nana would elaborate more on that. But I have made a mnemonic for remembering these immunoglobulins. Dimag, D-E-M-A-J, Dimag is a Urdu word or Hindi word. So IgD, IgE, IgM, IgA, IgGs, these are very common. And if many patients come and say, my IgE is increased, I'm allergic. So they know it by now. And basically it is IgG, which we see more in reports, and we talk more and we discuss more. So summing up the answer to your questions, that there is an immune system existing in every mature person who is full-term born, who is not immune deficient. Because I am stressing on this point that the other side of the story is immunodeficiency, which can be congenital or acquired. So again, our colleague Nana would elaborate this. But I would say some very common diseases to have an introduction for those who want to know why we are discussing this, that we were taught as a student that we have grade 6 autoimmune diseases like rheumatoid arthritis, SLE, rheumatic heart disease, and polyarthritis nodosa, and a group of some other syndromes associated with arthropathies. Like in rheumatoid, we had a Still's disease juvenile or Feltis syndrome, and so on. Then we have diseases like thyroid disease, very commonly, which presents with hyperthyroidism, Graves' disease. Then we have abdominal disease, which most of the physicians miss, celiac disease, what we call as. And then we have autoimmune hemolytic anemia, which is also very difficult to spot and diagnose. Then very commonly, both for the whole world, you're talking at the world level. So I would say the most important autoimmune disease for the world today to know fully is diabetes mellitus type 1. And then there are minor things like psoriasis. And then there are certain more less commonly known syndromes which we never see in day-to-day practice, like ataxia, telangiectasia, and things like that. And they require a multi-pronged approach. To cut the answer short, that immunity is relevant in day-to-day life. It belongs to every system. The whole body can be involved. We have seen in the corona days and the post-COVID days, we are still seeing the after effects of those attacks by the coronavirus spike proteins on the various cells, how it has damaged. I myself have suffered from an anemia of the type of myelosuppression due to post-COVID effect. And who better than me can say about the harmful effect? My hemoglobin was never 10.6. And now I have with great effort brought it up to 12.1. So this day-to-day, we probably, as we are knowing more about this wicked enemy, COVID, we are probably exploring immunological side of this story of COVID viral infections and how they have modified our cells, how they have affected, this virus has affected our cellular behavior. Its RNA has gone into our cells, some people are saying, and it would probably persist for a longer period, and we have to really keep our immunity strong. So I'm coming back to keeping our immunity strong, which would be the last part of the discussion. But summing up, we can say autoimmune diseases do not come from abroad. They occur in our own body due to the wrong signals or our cells not recognizing our own cells, start eating them up. In a common language, and then they present with autoimmune syndromes, and to the extent that some syndromes are very, very difficult to treat. Of course, most of them are not fatal, but somehow these are very difficult to treat, and we have to suppress the immune system as a bargain to keep our life going. Thank you very much for this question.
Thank you, Dr. Wali. That has been very enlightening. In fact, you have answered a lot of other, you've covered a lot of other aspects, including the immunological disorders. So my next question goes to Dr. Naina. Dr. Naina, can you please elaborate on your perspective of the immunological disorders and also the ways and means of diagnosing them? Dr. Naina, you're muted.
Yeah, I got that. Thank you so much, Dr. And I echo Dr. Mohsin Wali's statement in congratulating Medscape and the Fit India movement on their achieving this milestone. I echo again also Dr. Wali's statements regarding the immunodeficiency or immune diseases basically. When we say immunity, right, if we goes back to the basic, what do you mean by immunity? It refers to our body's response basically towards the injury caused by any foreign substance, including the microorganisms. Now, most of the time when we say I have a good immunity, what we mean is that our response to this is beneficial to ourselves. But there are certain situations when the response what we have against these foreign substances is not beneficial to us, but in fact it's harmful to us. Now, if I have to broadly classify to this response, I will classify these harmful responses into three parts. One would be a hypersensitivity reaction. Second would be, as pointed out so well by Dr. Wali, is the autoimmune disorder. And the third would be an immunodeficiency disorder. So when we look at the hypersensitivity reaction, what we mean is that you have an exaggerated response. So this exaggerated immune response, what we have, instead of being beneficial to us, is in fact harming ourselves. Now we all know, we have studied it in the basic, that there are 4 types of hypersensitivity reaction, 1, 2, 3, 4, depending on what the mechanism of hypersensitivity is all about. And also, of course, there's a type I hypersensitivity reaction also nowadays. Then what we have basically, which has been so well elaborated by Dr. Wali, is about autoimmune disorders. Our own defense mechanism. Okay. Now it starts acting against our own body. So whether you have this lupus, we talked of previous disease, instead of the immune cells acting against the foreigns, they fail to recognize our own body cells as own and start acting against them. And again, we have an harmful effect. That was the second part. And third part, what we're looking at, and which was of more concern during the time of pandemic, as we looked at, was about the immunodeficiency disorders. In immunodeficiency disorders, what happens that our body's defense system is deficient. It can be a single system which is deficient, or it can be multiple systems which can be deficient. Now, this can be deficient right at the time of birth, that is the genetic or the primary immunodeficiency, what we call off, or it can be due to various other factors, maybe like age, at the extremes of age, which are the physiological. Even sometimes there is a bit of immunodeficiency during pregnancy, what we are looking at. As Dr. Wali said, when somebody is on immunosuppressive therapy or corticosteroid therapy, or it can be also something like a malnutrition, certain drugs. So there are various kinds, because of this immunodeficiency can occur at a later stage in life, and which we call as a secondary immunodeficiency. One of the commonest cause of secondary immunodeficiency, what we are looking at, is today's an HIV infection. We know HIV infection leads to AIDS, which is again a cause of secondary immunodeficiency. Now, when we talk of any disorders of the immune system, I would look at these 3 factors which would come into play. And as Dr. Wali said, that we have a defense mechanism like Army, Navy, as well as your air. Similarly, when we look at our defense, innate immunity is something which is a non-specific, and which is something which we are all born with. Okay, there are various secretions in the body, the anatomical and physiological barriers in the body, which all play a part. There are certain cells which play a part in the innate immunity. And then there is an acquired immunity, which can be cell-mediated immunity or it can be invural immunity. Now, when we talk of any of the disturbances in the immune system, any or all of them can be affected. So, depending on what is affected, the infections occur. Broadly speaking, and actually in a very layman term, when we say that the cell-mediated immunity is affected, we have more infections within intra or cellular organisms like viruses, mycobacteria, etc., like happens in the case of HIV. When the antibody-mediated immunity or acquired immunity is affected, what we have is basically more infections with our extracellular organs. So depending on what is definition, you can have a specific T cell deficiency, you can have a B cell deficiency, you can have even deficiency of the phagocytes, complements, individual cells. You know, if you look at the permutations and combinations of deficiencies, what we can have are huge. So believe me, diagnosing any of them is a Herculean task. It is not easy to diagnose. So there are certain markers which can help us to know whether a person is deficient or not, or there's some problem. And one of the commonest what you can have, especially when you're looking at primary immunodeficiencies, when a child comes to you with repeated infections, which are much more than what is normally expected. You know, the children, like that the immunity takes some time to develop. So at up to a certain age, is protected by the maternal antibodies, especially the IgG, which Dr. Wali has talked about, which can protect up to say 6 months to 1 year of age. But beyond that, up to 5 years of the child is prone to repeated infections because his immune system is not developed. And we all know that immunity against proteins is developed much faster than that against the carbohydrate. That is the T cell independent mechanism what we are looking at. But if you see a child who is getting repeated infections, that is the idea which tells you that the child has immune mechanism. Another common question which I want you to understand, that when you're diagnosing this, it is not an easy process. So as I said, one of the earliest clues would be a child getting repeated infections. And then you will have to start with something like a basic CBC. Okay. You look at the total counts, you look at the differential count, and in that you will see certain variations. You will see that the counts are repeatedly low in a particular person. So that would be your second clue to tell you that there is some deficiency in. And one has to remember that it is not only the counts what we are looking at. Sometimes it is the counts are not, but the functionality is not there. Now this happens so in the case of phagocytes. So if you have to go set by set, so there are various cells. So we can do a B cell deficiency when you are suspecting you are getting a lot of extracellular infections. You know that the total immunoglobulin, so you can go for a total immunoglobulin estimation. It can be any of the DMAG or DEMAG, what anti-immunoglobulins Dr. Wali said. So you can do the total or combined. So you have to go for the total estimation. Then you can go for the antibody response to a specific. It can be a T cell dependent pathway or it can be a T cell independent pathway. You can give a known vaccine and look for the response or the increase in the antibodies in that person. So that can also tell us, you know. And we have certain B cell looking at actually the B cell using the flow cytometry. So these are the commonest methods, common methods which can be looked for to look for the B cell deficiency. When you come to know the T cell deficiency, as I said, the first thing what will be helping us would be your CBC. TLC, DLC both, that will give us an idea. In the US, if you look at it, because they have a lot of severe combined immunodeficiency cases, they have something called as a T cell receptor excision circle, that's a TREC test, you know, which is compulsorily in a dried blood spot in all the newborn children. So it helps us diagnose the severe combined immunodeficiency in a newborn child. But in India, we have still not gone to that level. But in cases where suspected, you can do the TREC test, you can do the flow cytometry, and also you can look to the response to proliferation or production of cytokines on the different stimuli. It can be a mitogen, it can be any of the known stimuli. So these are the various ways. But believe me, most of these tests, what we're talking of for immunodeficiency, these are not commonly available in majority of the labs. So there are certain specialized lab or very high-end, reference lab, which will be doing this test. So if you're saying that I can go and get this test at any of the labs, they will not be available. Third test, when you're talking of T cell, after B cell, we come to the phagocytes. In the phagocytes, as I said, you have to have the complete functional as well as total quantitative as well as quantitative test, what I was talking of. Quantitative test is easily we can do by flow cytometry also, you can do by the neutrophil count, absolute neutrophil count. But for quantitation test, again for phagocyte, we have definitions basically where you can have the oxidative burst using flow cytometry. Now that is a commonly test what we are talking of as the test, or you can do the leukocyte adhesion deficiency. So both of these are common deficiencies what we see in a phagocyte which can be done. For complement, what we have basically is the total hemolytic complement assay or CH50. Now this again can be tell us what the functionality of the complement, whether it's the alternate complement pathway or is the classical complement pathway. But each at the end, if I have to say one word, I would say that a strong clinical suspicion will require, and plus it will have to be a combination of tests which will tell you that how to go about procedure. There is no clear-cut formula as to how you are going to go about diagnosing this. So if I have to give up algorithm, you do this test, if this is positive, negative, nothing like that. About the autoantibody, there are certain autoimmunity. There are certain anti-nuclear antibody tests which are usually commonly does, which tell us that the antibodies which are present are higher in count. Again, you CBC, you see a higher count, or as you said initially that IgE is बढ़ गया है, तो मुझे पता है कि मेरे बढ़ गया है, तो मुझे पता है मुझे allergic reactions. So, certain clues which can help in diagnosing this different tests. Another point which I want to highlight, because it's a commonly asked questions by quite a few people, that I have been vaccinated by COVID. Why do I get still COVID infection? Here, when you talk of immunity, again, that one concept I want you to, the participants to understand that there's something called as a local immunity and there's something called as a systemic immunity. So when you talk local immunity, for that, basically, it is usually IgA derived, which is present in the respiratory tract. And the vaccines which we are taking are basically systemic infections. So they are not in high numbers in the local or the respiratory tract. And the COVID spreads basically through that route. So when a person is exposed to COVID infection, what happens is basically he gets infected. But because the virus enters the body, the systemic response is there, and therefore the infection is there. So it is not breaking the transmission of infection as we see in the cases of oral polio vaccine, where the transmission chain of transmission is broken. Here the chain of transmission is not broken. So when you have to look at that local immunity is not so very high after the systemic vaccines that we are taking. And what we have to achieve, another term when we talk of immunity, is herd immunity. That herd immunity is, that's why we say that more the people get infected, we'll have a herd. So it again break the chain of transmission, and then what we can have is maybe the disease can be controlled, even the new variants come. Thank you so much. I hope I have been clear in what's my... Thank you so much.
Thank you, Dr. Naina. Thank you so much. It is a very, very elaborate subject, and it is also a very specialized subject. It's not very easy to understand. By talking few minutes, we will not be able to understand. So you did mention about one question which comes to my mind after listening to you is, you said clinical pointers will decide which test to be done.
Yeah.
So can you just very briefly yourself or Dr. Wali?
There are 10 warning signs which are basically tell us what are the 8 or more new infections with the ear infections within a year, 2 or more serious sinus infections within a year, 2 or more months on antibiotics with little effect, 2 or more pneumonias within a year, failure of an infant to gain weight or grow normally, recurrent deep abscesses in the skin or organs, persistent thrush in mouth or on skin after age 1, need of intravenous antibiotics to clear infections, 2 or more deep-seated infections such as meningitis, osteomyelitis, cellulitis, or sepsis. And of course, last but not the least, a family history of primary immunodeficiency. So any of these signs what we have, basically for looking at it, that will help us to know that this child might be suffering from primary immunodeficiency.
Wow, that is very helpful because every time a person gets infection, a little bit infection, they feel, oh, their immunity is low and they should work up for low immunity, which really doesn't work.
Unfortunately for us, our history, the patient which gives often is not very reliable. And our record system is sometimes not good, because the patient keeps on going from doctor to doctor. And they don't give the past history, So sometimes that is one of the reasons why it is not detected fast. So in this case, when specifically you have to, history taking really would play a very important role, as Dr. Wali, I think, would agree with me.
Right. Thank you so much. My next question is to Dr. Wali. Dr. Wali, are you around?
Yes. If you can hear me.
Yes. While you were talking about immunity and the role of immunological disorders and all these things, I did realize that there are a lot of post-COVID immunological issues, different types of issues. Like you said, you went through a phase where anemia, hemolytic anemia. Did you say hemolytic anemia?
No, it was myelosuppression, ma'am.
Myelosuppression.
Myelosuppression is very less talked about, but many people have it. So tremendous weakness, myelosuppression, And
Right. So, do you have any meaning? Do you have experience of patients who have developed different kinds of post-COVID immunological disorders?
yes, actually, COVID is basically, initially we thought it is a simple viral infection. Then we thought it is a clotting disease or bleeding disease because procoagulant and anticoagulant pathways were affected. But what it boils down to me is it's basically it shakes the immunity of the body. It immunomodulates the body, it immunosuppresses the body. And my doctor told me, who is operating eye cataracts, that he is not operating for post-COVID cataract sufferers, because in the Delhi we had very heavy summer and very intense summer. Because of that, he is scared that those people will get infection. So, like we talk of mental fog, brain fog, or we talk of certain other things. I think maybe tomorrow or later, doctors like Nana Ingole would come up and tell, no, look here, this is all immunologically derived syndromes. And these syndromes will be studied in detail. I'm sure that there is all that is happening in COVID is all around T cells and B cells and bone marrow plasma cells, and various powerhouses of immunity are being affected. But what I want to say for a common people, common listener is that COVID has shaken our immunity. Luckily, this last variant did not do much, but the Delta did a lot. And I had been hearing the legends from USA and UK and Paris and other countries. They were all working hard to find out the cellular basis of post-COVID problems. Like many people had brain fog, many people had even hair fall. The bonds between the scalp hair and what we know as it's a sulfhydryl link, but what weakens that link, and people, the girls especially, were concerned about loss of hair. So this is a very small thing for a doctor to know hair fall, and we prescribe something, but for a young girl who has lost 1/3 of the hair is a very big loss. So we have to really find out tomorrow that how we can counteract. And the most important immunosuppression, which is iatrogenic, we have produced is by giving steroids. Like for a common man, it was a disaster, fungus coming, black fungus coming, then yellow fungus, white fungus, and so on. The people were very sensitized about these fungal infections, super infections. But what we learned after that, after a couple of months later, after a year later, was that incidence of diabetes has gone up 7%. Incidence of obesity has gone up. So all these systemic changes which had taken place in survivors, forget those who have died, lots of people, friends, doctors we have lost. And I would like to pay my tribute and my sincere tribute to all those colleagues on this Doctor's Day home. We have left, we have lost, and those who have left this world without any premonition, warning, or without being so old to leave this world. So suddenly we left, so many friends have left us. So it was a great loss to the medical fraternity, unaware. We stood unaware and watching that how it was all happening. So this all has given us big lessons to learn, and for future big work to do in the various labs. And probably some labs have started based on targeted next generation sequencing, and to study those IEIs, like Nana would know more than me. I'm just a student learning from her. IEI, that is inborn error of immunity, and next generation sequencing. And we have been talking of genome sequencing in COVID. So these words have come in the knowledge of common man. So this is a big thing. So there are laboratories, and I am aware of one laboratory designated in Chandigarh, which is doing targeted customized 44 gene pattern. PGI Chandigarh is doing this great work. And we are now side by side learning from very mysterious diseases like disseminated sclerosis or multiple sclerosis by doing some new experiment on immunology and taking out of box, our thinking out of box, and to find out the management through newer techniques to study oligodendrocytes, their metabolites, the peculiar cells which develop. So this is something new. New era is opening. The immunology is a big field tomorrow, and all the diagnostics as well as immunology itself would open a new thinking for the clinicians also, because we treat patients and doctors like Nana work in the lab, and they know more about these cells, their behavior, our proteins, their behavior, and how does these things get changed and how we can identify them. And it's a big work to be done in future. And as we were talking about the future things, these are some of the future things. I'll give you an example of autoimmune lymphoproliferative diseases. So this is a new group of are being identified, and I am watching as a clinician a lot of people, a lot of girls especially, who have thyroid. Somehow more of them have tuberculosis. This is my observation for sustained 40-45 years, that somewhere thyroid disease and tuberculosis is interrelated. So this is just one observation. So there are certain diseases which are associated, and they have all, if we trace them back, have immunological linkages, and we have to learn them more. You see, we have now treatment modality based on these mechanisms. So we have devised antibodies, monoclonal antibodies, targeted antibodies, and we have, you name a thing and we have it. Just now you have heard that anti-cancer drug, colorectal drug, duocenumab. So all these things are coming up in a big way. Cancer therapy is having a renaissance based and assisted by immunologists. So a lot of things, new things are developing, and there is overlapping areas where we are treating diseases, and probably we are conquering, like they made bigger claims for this colorectal drug. Of course, it is under confirmatory trials. So
right, sir, you have opened up new thought processes, new avenues for studies and clinical trials and research. And I would request Dr. Naina to just very quickly let us know as to what are the tests which are done now to assess the immunological status in a patient who has already had COVID. So is there anything which has come up already, or we are still in?
That is a very tricky question, because when the COVID started, everyone was busy getting their antibody test done.
Correct.
They wanted to get the IgG, they wanted to get the IgM, then there were certain tests which came up with neutralizing antibodies. As I said, the role of any of this test has not been proven. There are still studies underway where, because when you look at it, there are always three factors in any epidemiological trial. We're looking at the host factor, we're looking at the virus factor, and we're looking at the environmental factor. Now, when we look at the host factors, as Dr. Wali said, there are a lot of immunodeficiencies of comorbid conditions, and we have seen that the severity in these conditions was higher, because obviously the immunity in these people was comparatively lower. But when you look at the virus factor, and that is what everyone was doing, there have been people who have even with a very high antibody levels, they have still got reinfected or infected. So, if you're asking me for a question as to what is one test which will tell you, I really don't have an answer for that. There have been a lot of studies going on where we do the T-cell studies. In our own institute, our head of department has recently established a immunologist center of excellence, where we have going to study all the immunological factors associated, or the T-cell factors associated with COVID, and the studies are underway. There are other institutes which are doing, but as of now, if you ask me, I really don't think we have an answer to that question as to in COVID, what will tell us that you are protected against the COVID and what will tell you against you are not. The only thing we can tell here is, if your antibody levels are high, you have been infected previously, the chances of you getting a serious infection are much lower. But what should be the cutoff? I am really not in a position to say. Sorry for that.
Right. So that has been very enlightening. The entire session has been really great, but it also shows us that there is a lot to be learned, there is a lot to be researched, and there is a lot to be discussed still. Before we leave, I would like to ask one question, the last question to both of y'all, as to what are your take-home messages and what are your recommendations to the world in the post-pandemic era regarding immunity. Dr. Wali and then Dr. Naina, please.
Post-pandemic era, it's a new world order for the world. It's a new world order.
Yes.
People are changing, things are changing, money is changing, homes are changing. So many people have lost lives and so many people have changed behavior. So what is my message to the community, world community, my colleagues, those people who are hearing this, that develop hygienic trends, develop sanitary trends, eat home cooked food, eat a lot of vitamins. There are details, what not to eat, what to eat, but basic vitamins, I would vote for vitamin D and vitamin C unanimously. Other things like quercetin and other things which we recommend, they are all secondary, but vitamin D has been proven beneficial, vitamin C has been proven for immunity. For the topic of today, get vaccinated. All other vaccines, not only COVID vaccines. Keep your children vaccinated, get yourself vaccinated. Then avoid contact with sick people. And the biggest word for our program, Fit India program, join Fit India program and remain fit. If you are fit, I have seen people who are fit, who are village dwellers, they have been less affected by COVID and all other conditions. I have people who are coming to me at the age of 19 and never been to a doctor. My own father never been to me as a patient, and he was never diabetic. At the age of 90, I pushed him to a cath lab and got his angiography done so that he suddenly would not have a coronary attack. So his coronary arteries were better than my coronary arteries. So those people who have exercised, who have walked, who have cycled, who have eaten fresh food, who have breathed the best air quality. Of course, pollution is the biggest enemy. It causes a lot of injury to the blood cells, body cells, and all epithelial cells, leading to immune disorders and triggering for immune disorders. So my basic message is eat healthy, have enough sleep, and avoid stress. These are the three bottom lines at which I would end, and give cooperation to our Sunita Dubey in her Fit India movement and be a part of Fit India movement. And on Doctors Day, I again wish all the doctors and appreciate the good services for our group of doctors also, who have selflessly treated COVID patients at their own health cost, at their cost, day and night, neglecting their parents, families, children, and everything, their food. And I have a lot of sympathy for my colleagues who have lost their lives, and I pay tribute at the end again. And thank you, ma'am Sushmita. And I learned a lot of things from Naina today, and I'll keep learning. My basic aim to come to this webinar was to learn something new, which I didn't know. So I have done that. I have learned so many things. But my appeal to everyone who is listening this webinar is eat healthy, sleep well, avoid stress. These are the three basic messages for today.
Very well said, Dr. Wali. Over to Dr. Naina, please.
I think Dr. Wali has already said most of the points which I wanted to say. And as he rightly said, immunity doesn't lie with any one factor. The three factors which he has highlighted, but here I would highlight one more factor apart from what he has said, and that is injudicious use of antibiotics. Because even our normal flora plays a very big role in our immunity, especially our gut microbiome, what we're taking. And this injudicious use of antibiotics, what we're looking at, it destroys, you have antibiotic associated colitis, and you have a lot of other infections also which are occurring. They have a symbiotic relationship. So I think that is one point I would like to add to all the other points which have been already said by Dr. Wali, and which I will not repeat. Thank you so much, and best wishes.
Thank you so much, both the esteemed panelists. I am really, truly thankful and grateful to you for being here today with us on Doctors Day and with the Fit India movement. Thank you again.
Enhanced immunity is the real way to save the world community. The strong message delivered today by our panelists. Thank you very much, Dr. Naina Ingole, Dr. Mohsin Wali, Dr. Shushmita Bhatnagar, for this eye-opener for the entire world. Thank you very much. Ladies and gentlemen, viral pandemics are open battles in the health sectors, but there's one entity which is killing us slowly but exponentially, that is cancer. And to make us aware and sanitize on the oral cancer prevention, may we please request our dental surgeon, the founder of Indian Academy of Aesthetic and Cosmetic Dentistry, and the consultant for the Miss India Smiles for over 27 years. Please join me in welcoming with a loud round of applause. जो हमारे दांतों के साथ भी है, दांतों के बाद भी है. May we please welcome the father of modern dentistry, Dr. Sandesh Maikar.
Hi, this is Dr. Sandesh Maikar, a dentist from Mumbai. First, I would like to congratulate Medscape India for their 16th Foundation Day and also the completing 8th year of Fit India movements. Also congratulate them for having this beautiful initiative called Fit India Doctors Conclave. Being a dentist, you are always concerned of one of the most important aspects in oral cavities, oral cancer. Well, I did my post-graduation in oral pathology and I did research on oral cancer also. So everybody speaks about how to stop oral cancer by showing those pictures before the movie, after the movie, etc. to scare people. My take is a little different. My take is prevention. Now, oral cancer is always preceded by pre-cancer condition. Oral cancer is seen in the mouth compared to any other cancer in the body. Oral cancer can happen only because of bad habits or because of a sharp tooth or denture or cap or anything sharp irritating the gums, tongue, cheeks, etc. So friends, what are the habits which can cause oral cancer? As we are talking especially for Kashmir, we are talking especially for people of Kashmir who are not economically that forward, but still we can prevent this oral cancer in economically backward people also. So I was talking about habit is tobacco chewing, betel nut with tobacco. So what people do is they take betel nut, tobacco, mix it like this and put it in one corner of the mouth because they get that salivation and a kick. What happens as they put every day, the habit is to put again and again, and after some time, instead of putting it for some time, they put it for more time because they don't get kicked. And why do they get kicked? Because that tissue in the mouth becomes white, there's a patch, and it doesn't give that sensation. So again and again putting there, it turns into a white patch which we call as a pre-cancer or leukoplakia. And if you don't take care of that leukoplakia, that means you don't remove that patch, it will turn into a cancer. That means what? First, to stop the habit. But habit is body memory, nobody can stop habit. So what is the prevention? Prevention is to not start the habit. So when is that they start the habit? We did a survey in Mumbai, near Mumbai called Bhiwandi, and we found children at the age of 8, 9, 10, 11 having tobacco, and we were surprised. So we asked them why are they having tobacco, and they said, well, as everybody has got some mentor in their life, so they said that my mentor is my father, second said my mentor is my uncle, वो खाते इसलिए हम खाते, they eat so I am eating. So the first thing is to let's go and catch them young, is parents, anybody should take care of their children and see to it that they don't eat tobacco in front of them, that they will develop the habit or they will start. So that's one prevention. And that's the best way to do it, is to not start that. habit. The moment you start eating tobacco and brittle nuts, big tobacco, etc., that kills your appetite. So many people have that so that they don't spend time or money on food. You see the richest of the rich, they carry that pan masala dabba in their hand, is to kill the appetite because they don't have time for the food. Both are equally bad. The second thing of prevention, according to me, is that I would like to teach all the population is how to detect pre-cancer. It's very easy. If you got a habit of smoking or tobacco, just check your mouth in the mirror, which you do every day while brushing, whether there is a white patch. The moment there is a white patch, remove that white patch in that condition, which is pre-cancer, and I don't think we'll get cancer. So why to wait to get cancer and then get into treatment, etc. Because there is no treatment for cancer as of now. So oral cancer is easy to detect at pre-cancerous condition. If you remove that patch, you will never get cancer. So whether your denture is hurting, any ulcer which become painless is a question mark. So any trauma to your oral cavity has to be checked immediately, and you have to just treat that as soon as possible and not to postpone. Any postponement of any disease is going to become bad to worse as far as oral cavity is concerned, because there is nothing called self-cure in oral cavity. So friends, we can easily avoid getting cancer by prevention, not start the habit. If your habit, I always tell them, keep it here for a couple of days, keep it here, change the positions so that you don't get a white patch. If I tell them to stop, they will never like me, they will not look at me. It's very difficult to tell anybody, even an educated person. I've seen a lot of film stars, they don't stop smoking.
Thank you for the great insights by you, Dr. Sandesh Maika, sir. We are truly, truly thankful to you for every single topic of discussion and for creating awareness amongst the masses. Thank you. Our next session, ladies and gentlemen, as we always know, since the past 2.5 years, the buzzword is immunity. As we always say, and doctors tell us, immunity ko badao. But kis tarah? So here we have with us our next session, immunity word of buzz for both doctors as well as the patients. Immunity, the hottest word and the hottest topic worldwide. Thanks to COVID pandemic, there's one man in the world of homeopathy who has dedicated his life to make people understand immunity by homeopathy. So please put your hands to welcome our living legend in the world of homeopathy to speak on immunity word of buzz for both the doctors and the patients. Our founder of the brand Batra Homeopathy. May we please kindly invite Padma Shri, Shri Dr. Mukesh Batra ji.
At the outset, let me congratulate Dr. Sunita Dubey and the team of Medscape India and the Fit India movement for celebrating Doctors' Day every year in a unique manner. The goodness of doctors and all those in the medical and paramedical profession came to the forefront with the sacrifices they made during COVID. COVID also created the buzzword immunity among doctors, patients, and the media. So what really is immunity? It was the Romans who first discovered the word immunitas, which freed people from paying taxes or paying tributes to Rome. Later, the word was used in Africa as being immune to poisonous snake bites. So, speaking for a common man, the word immunity is the body's capability to protect itself against infection. Immunity is commonly of two types, inherent or acquired, and can also be developed through ways, either through infection or by vaccination. Interestingly, at the end of the first millennium, immunity to smallpox was built by the homeopathic principle of taking powdered scabs and blowing them through straws into the lungs of healthy individuals. The modern theory of vaccination is based on the homeopathic principle of similars, introducing a very small portion of the virus into the body and allowing the body to build antibodies as a defense mechanism for future infections. Lowered immunity can be caused by a number of factors, including poor diet, certain medications such as chemotherapy, and in patients suffering from autoimmune disorders. Symptoms such as frequent colds, lingering infections, tiredness on least exertion, and long-lasting digestive issues should alert both the doctor and the patient to a low immune system. Research has shown that stress has a direct relation to lowered immunity. It can exist in two forms: physiochemical and psychological. Physiochemical results from environmental factors such as food, nutrition, infections, and inflammation. Psychological factors from stress, which cause persistent cortisol and corticosteroid levels, which in turn reduce the anti-inflammatory effects on the immune system. Let us remember that immunity is not built overnight and needs a lifestyle change over a period of time to sustain it. Hence, eating a healthy diet, exercising regularly, sleeping well, drinking enough fluids, and minimizing stress levels are ways to build a healthy immune system. The answer to build immunity over a period of time must therefore come from a holistic system of medicine like.
Wow, this has been truly amazing. Immunity बढ़ाओ, जिंदगी बढ़ाओ. बहुत बहुत शुक्रिया Padma Shri Dr. Mukesh Batra sir. What an outstanding session. And of course, अब हम सब health में अपने best versions हो सकते हैं. Thank you very much once again, Padma Shri Dr. Mukesh Batra ji. And now we are here up to a very important discussion relating to the youth of today. Our topic is youth drug addiction prevention and solution. As we all know, youth are the future of our society. Drugs take you to hell disguised in heaven. Drug addiction in youth destroys lives, tears apart families, and harms the society. Eventually, kills the nation, kills the society. We cannot always build the future for our youth, but certainly we can build our youth for the future. Medscape India, ladies and gentlemen, is committed for drugs-free youth and drugs-free India. On the backdrop of this revolutionary thought process, let's truly begin the panel discussion. Youth drug addiction prevention and the solution. May we please welcome our honorable panelists here. Join me in welcoming our panelists. The chairperson for this important session is an iron lady, the pioneer in the field of assisted reproduction in India, specialist in reproductive endocrinology, the ovarian physiology. Let's please welcome with a loud round of applause the most recognized name in the Indian medical sector, the one and only Padma Shri Dr. Kamini Rao ma'am. तहे दिल से स्वागत है Padma Shri Dr. Kamini Rao ma'am. To find out the real solutions, Dr. Rao will be assisted by the prime thinkers from the medical field. And it's an honor for all of us to call upon the doctors offering their medical services and catering drug addict youth in Amritsar, trying to solve the Udta Punjab problem with human zeal. Let's truly welcome Dr. Sarpreet Singh Gilji. Namaste, Sat Sri Akal, Dr. Sarpreet Singh Gill ji. Drug attacks the mind, and attacked mind accepts the drug. There is doctor addressing the issue of drug and mind. She's none other than the renowned psychiatrist, the founder of Mind Temple, Institute of Behavioral Sciences, Salam Bombay Foundation Director, Dr. Anjali Chhabria ji. We welcome you, Dr. Anjali Chhabria. And to join this eminent panel, let me also welcome the doctor who understands the toxicological aspects of drugs, forensic medicine expert, and our winner of the Indian Achievers Award, Honorable Dr. Rajesh Dere. We welcome you, Dr. Rajesh Dere. The panel discussion on youth who truly need this very wonderful session, and parents need the right guidance, how to truly definitely train the youth to be and to live a drug-free life. Will we please start with a panel discussion? Thank you very much. To our chairperson, please. Thank you, ma'am.
Good morning, everybody. Doctors' Day, the 1st of July, is celebrated all over the world. And it is, for our organization, very important as the 16th Foundation Day and completing 8 years of Fit India movement and the fifth Fit India Doctors Conclave. The initiative celebrated as an immunity day, and many doctors across the country and associates creating awareness and influencing the minds of citizens for better health to fight the future pandemic. In the past, Niti Aayog, Ayush, Ministry of External Affairs partner with various states and global leaders. Health is a subject that needs collective participation. It cannot be a single person. Doctors can be the torchbearers of peace, good health, and happiness. This program will bring positivity as it is the first unique program with people of Kashmir along with the doctors from Medscape India. What a lovely program to have people shoulder the burden together, because it's always to have people together where 2 and 2 will not make 4, but will make 22. Medscape India and AMED has been undertaking volunteer-based plethora of philanthropic activities in health and medical sectors for making our nation the best in the world. What more can be said for Medscape? Because they have a finger in every aspect of the medical field, be it awards, be it in terms of illnesses, in education, and in any kind of natural disasters. This year, Medscape have extended its reach to Kashmir and have to undertake medical support to the poor and needy people of Kashmir. It's a joint effort of Medscape doctors from Maharashtra and different parts and different states, doctors of Kashmir with the Directorate of Health Services. I now bring to you a unique program in this particular Doctors' Day, the 1st of July, where Medscape India and our panel of excellent doctors, where we are going to be discussing on the menace of drug abuse, where we have seen that this has been on the rise, and it is seen in the northern parts of India, particularly in areas of Punjab, Haryana, and Kashmir. I have an excellent panel of speakers here who will be debating on this issue as to how we can tackle this menace, not alone, but together. And with me, who best can I have? We have Anjali Chhabria here with me, who's a psychiatrist, Dr. Sarpreet, who's been on the ground, doctor treating people day in and day out, And we have Dr. Rajesh, who's been also doing the forensic part, who will also explain the legality of this problem. I'm sure this has been a bedroom scene all these days. People know about it, they fear about it, but it is always socially ostracized and nobody wants to talk about it. So let's take this bedroom problem into the boardroom and let's talk about it. So my first question to Anjali. Now, Anjali, you know this problem is a big menace and it's only the tip of the iceberg that we see. We see a single case, and if we miss that, we have lost an entire community that we could actually pick up, because they all work in herds. You know, such a well-oiled community that you pick one person, you can pick up the whole lot. So Anjali, what is your experience as a psychiatrist and an excellent counselor in these kind of cases? How has your experience been?
Thank you, Dr. Kamini, for including me in this discussion. And I think it's an extremely important topic today, more so than ever. And in my last 33 years of working with people, you know, what I have seen is that this is a menace which is just increasing over the years. And unfortunately, drugs are being normalized. And that is a huge problem, you know, because when anything starts getting accepted, oh, ye to normal hai, that is the time we as a society, and especially us doctors, have to really worry and do not only work, you know, we have to work together. So I'm very, very thankful that we are discussing this issue today, and we've decided to take the bull by the horns. Of course, earlier what we would see, you know, in the last 30 years, what I have seen is that, yes, of course, drug abuse has always been there. But what has changed is the way, you know, earlier it would be that probably only people who were very, very rich or very poor would take drugs. Now what we see is our middle class is getting affected. Our normal houses are getting affected. And as you rightly said, that if there is one addict in the house, the entire house suffers, you know, and if we miss one addict, we are actually missing a cohort of young individuals who could actually be channelized to do such fantastic work. The second point I would like to make over here is that, you know, unfortunately, we look at them as if they're criminals, but actually, this is a medical problem and it should be treated medically. Because if we do a survey, just like in any other condition, what we will see is that they have been genetically affected. Okay, their personality, because of personality defects which have not been picked up, you know, in school or by the family, these people are not getting the help that they can. Society, unfortunately, either is extremely cruel to this problem, and we need to work at a macro level to look at these people as they are sick, and we need to help each one of them. We also need to empower their parents, their families, and schools, colleges, and other educational institutes how to recognize this problem and how to deal with it.
Thanks, Anjali, because you've really touched upon a very, very sensitive issue to say that society has to be inclusive, society has to be understanding, empathic, and these are some of the points and adjectives that has to be actually borne by the support group, which is the immediate family and the society. Now, if you were to look at these drug addicts, they are not drug addicts by choice. It is just by circumstances, they become a victim and then suddenly slip into it and get addicted. They initially take it for fun, for a kick, and then suddenly they don't know how to get out. It's not that they're weak-minded, but it's just that they can't control themselves. Dr. Satpreet, I must ask you, you have been actually a grassroots worker, you've been with these people. Now, how do you identify that this person is a drug addict? Because most of them come with some physical symptoms. They will never tell you that I'm a drug addict. So how do you really identify that this person is a drug addict? And how do you actually, get them to accept that they're drug addict? Because the moment you say you are, they're out from your clinic and they will never come back to your clinic. So how do you actually, what magic do you have to still make them come back? Because that's an art in itself.
First and foremost, thanks to everyone, Medscape, Dr. Kamini, everyone for having me on this panel today. And the question you asked, ma'am, well, initially it is very difficult. Yes, when we start our practice with these type of patients, it is very difficult. And for a trained eye, when the person is walking in, by the time he reaches this patient's chair, we usually know he's a drug addict. We can almost be sure of what type of drug he's taking or she's taking. There are a lot of she's also, it's not just he's. So, and the main thing which you said is how to ask them to get back to you. Well, that is something which requires a lot of patience. It requires love. It requires a certain amount of, you have to exude that love for that patient. You cannot say you are doing wrong, you shouldn't. We can't go into the lecturing phase. That normal lecturing phase, ये नहीं करना चाहिए, ये गलत है, तुम क्यों कर रहे हो? If we start on those lines, I think they will never come back. So our way of tackling is to make them understand that we understand what you are going through. That is the first thing. We understand your state of mind. We understand your physical status. We understand your mental status. We understand how you are so dependent on a certain drug. And then we just have a small thing to say, okay, we want to help you with your help. We cannot help you by ourselves. We need a bit of help from you also. And if you are actually willing, make up your mind. Are you willing? Do you want to give it up? Because if you do not want to give it up from within your own self, I cannot make you do it. I may give you some medicines, I can give you treatment, you may become clean for maybe a month or 2 months or 3 months. But if you're not willing from the bottom of your heart, you'll be back again where you started after 3 months, after 4 months, whenever it is. So, and I would like to present a very interesting case which has been in my view for the last 3 years. Now, this boy, at the moment, 32 years old, he is now in jail. So that's what it is now. At the age of 23 or 24, he was Mr. Punjab. Mr. Punjab means he had everything that it took to stand on a stage with hundreds of other people and be counted and seen as someone exclusive who was the winner of Mr. Punjab. He had an extremely good physique. He was very good looking and he spoke well. He had, everything that is needed to be outstanding. He could have joined movies after that. He was so good. But somehow things so happened that what is happening in Punjab and what has happened in Punjab in the last 5 to 6 years, 10 years, 15 years is that as the cities have grown, the lands which come into the city suddenly become 10 to 20 times more expensive than what they were a few months ago. So now these people have land holdings. Someone has 100 acres, someone has 50 acres, someone has 20 acres. And at one time, if it is 1 lakh an acre, suddenly if it is, you are offered 30 lakhs an acre, it's like a, overnight boom. It's like you hit the jackpot. So someone who sells 20 acres suddenly has 2 crore rupees. So what do? They make a good house, they buy a new vehicle, they buy guns, and the next thing you know is they have been trapped by this mafia of the drugs peddlers and the drug users to come and at least try it once. As you said, ma'am, Kamini, on that they would once at first try it as on a casual basis, as something which relaxes them or something like that. And by the time they've done it 3 times or 4 times, there's no turning back. They're addicted to it. And the modus is the same. Modus operandi is absolutely the same. Initially, 2 times, 3 times, you're given it for free. The 3rd, 4th time or the 5th time, maybe they ask you for 100 rupees or 500 rupees or for something. And then suddenly the next day, it's 2000. And you're like, no, I don't have that money. Go get it. So you obviously, if you've sold land, you have a lot of money around. So 2000 in the morning, 2000 in the evening, you start spending 4000 rupees a day just for the drug. And as we all know, money is like a well. It will get empty. The more water you take out of it, it will get empty. And there is no refilling because you've already sold everything. You're not working. You've given up your professions. The only profession you knew was farming. And that you've given up because you've sold your lands. And that, whatever 2 crores, 5 crores, they just dry up. Within a year, 2 years, 5 years, they dry up. And then by that time, these boys are hardcore addicts who will do anything it takes to buy that one joint or one small little pudiya in the morning and one in the evening, costing them 4,000 rupees a day, which increases crime. It increases violence in the home because they sort of like the maximum fights are in the house with the wife, with the father, with the mother. I want money. I don't know where you get it from. Give it to me now. Give it to me now. And these things we have seen happening, especially in the case which I have been following, and I'm going to present a case study on that. That boy is now, if you see him walking towards you, his hands are 3 times to 4 times more swollen than what a normal hand is. His feet are totally, if you see his feet, they are totally finished because he's used every vein possible. His other veins of his body, which normally we can see, are all blocked. The only option now left is to go in for the femoral, and that is when they die. So this is something which is prevalent over a lot of areas in Punjab, or not only in the rural areas. It has now taken over in the urban areas too, where, as you might have heard, just day before yesterday, there was a rave party which was raided in Gurgaon, where they were actually using the antidote that we use for drug addicts. That was being used as a drug because that too is habit forming. So we have actually no roadmap. We do not know what is happening. We do not know how many of them are actually trapped into this. I have declared at least 73 boys between the age of 25 and 40 gone home and declared them dead because of an overdose in the last 7 to 8 years. And these are the cases which were reported to me. People who asked me to come home, see the child on the bed, ensure for them this, yes, he is no more, and just I had to walk out. So the first few times, it was very painful for me. It was very painful. But now it's like a routine. When you've done 73 declarations of death due to overdose, I think I expect it to happen almost every day. And I don't know what can be done about it. The only thing we can do and what we are doing is we are trying our best to give them the best treatment possible, to make sure that they are motivated to come out of this vicious, dirty circle which they are in. But I'm very sorry to say that out of the thousands of patients whom I know, maybe only two have been able to come out of it. The rest just cannot. I think we just go on and keep trying and maybe one day we'll have figures which are much more better or positive or encouraging. But right now, this is where we are.
So thank you, Dr. Satwik, because I find that this is a very sad state that it's almost what we would call as a kind of a chakravyuh, getting into it and not being able to get out of it. But having said that, the government, even though it sort of makes it a scheduled drug, and then for people who have cancer, end-stage cancer, these narcotics are given as pain relief. So even if they do get addicted to it, at least they have dignity in death. So I would now like to ask Rajesh with the question that there is some amount of legality or legalizing these kind of narcotics for pain relief in end-stage cancer, for example. But at the same time, it has to be as a scheduled drug and make sure that it can be given to patients or in the hospital. Because I remember as a clinic, as a hospital in my own place, another cardiologist suddenly came and asked me that I have a patient in my clinic who suddenly had a heart attack. And in those days, they used to give pethidine as well for pain. So I said, okay, I will give you 2 ampules, but you must return that back to me. So then I found that the next day he said, I had another patient who has a heart attack, and again I want 2. So I was surprised. Why will this cardiologist come and ask me the next day also 2 pethidine ampules? And my curiosity got better of me. And I found out from my other doctor colleagues, who is this person? Why is he asking? Then I said, I named that person, and then his own colleagues, cardiology colleagues said, oh my God, he's a drug addict. So please don't ever give it to him. So even then, you'll be surprised that he has been going from nursing home to inject himself with narcotics. So Rajesh, I just want to know from you, in some of the countries, at least in the US, they're actually making it legal. But yet in our country, what is the pros and cons of making these narcotics legal? And if they do make it legal, what are the implications?
Yeah, thank you, ma'am, for having me on this panel. I would just inform you all, Article 47 of this Constitution basically deals with this narcotics, drugs, and psychotropic drugs. And we all know we have a NDPS Act of 1985 in these countries, which regulates use and consumption and even transportation of all narcotic drugs. We have 83 sections with 6 chapters in this, and we have one of the severe punishment, may not be as severe in Dubai or in the Arabian countries because of religious constraint there, but all these offenses under this act are non-bailable and are punished minimum 10 years with say 1 or 2 lakh fine. What is more important as per your case, what you have said, even though we have major hospitals, like I'm working with say Lokmanya Tilak Municipal Hospital, or you may have your own nursing home clinic, for such narcotic which are allowed to be used as a painkiller in the terminal cases, I would say, you need to have a separate license for that, which again, I think you have gone through that pains of getting that license. I always advise
all these private hospitals, not corporate, but say nursing home, major nursing home, not to indulge in such, taking license for these narcotic drugs. If I take your example, as pethidine can be used in, say, acute myocardial infarction, now we have better painkillers, available in this market, which have some anesthetic effect also, which can easily do the work, which are not under the NDPS Act. So why to get involve ourselves in these all activities? It should only be what you said rightly, in some end stages of malignancy, cancer, where the routine available drugs, which are not scheduled under NDPS Act, can be used, but it is with all due constraint and all precautions to be used as in rarest of the rare case or as a last measure. As well, we have enough painkillers in our list which are not enlisted under this NDPS Act, which can act as a better painkiller for all the ailments instead of giving pethidines or some narcotic drugs, which is rarely to be used in some medical conditions which are legalized. Otherwise, all these drugs, all the drugs of NDPS Act, say we have 4 classifications in this. Stimulants like cocaine is there. We have depressants like alcohol. We have opium related. These are where I say these opioids or sleep inducing drugs or somniferous drugs, which are commonly used as and drug abusers like brown sugar, MD now is MD Meow Meow is available in local shops also even in Mumbai. In 2020, I would say, we all know that this Chandigarh and Punjab is the somewhat the badly affected state of this narcosis or the drug abuse. But in 2020, Mumbai reported maximum cases of recovery of the drug cocaine and related drugs in 2021. So Mumbai is also not far away. What is good in Mumbai, we have good tracking policies, but still, if you go to any slums, as one of our panelists has rightly said, not only the rich people is affected nowadays, it is the young generation from these jhoppadpattis or upper middle class. They are also getting all these cocaine crux or MD drugs, which are used commonly in the rave parties. This is a dangerous sign for society of this generation from 18 years to 14 years is mostly affected. And so we all, what is important in this, we have all legal laws in place. We have stringent actions. We have better qualification under NDPS Act. What is more required is to train this young generation how to avoid these drugs. If I take an example, like say alcohol misuse or alcohol abuse. Alcohol again is a good depressant under this act, and this alcohol is used as a status symbols in most of our parties. And in most of our, say, nightlife, say pubs or lounge bars, along with these alcohols, some form of cannabis is found to be mixed and is recovered by the narcotics wing of our police. So this is where laws are in place. I think in my personal opinion, laws are stringent enough. But what is more important is to educate and to make aware our young generation regarding the ill effect of these drugs, how to be avoided.
Yeah, I think Rajesh, you really have elaborated it extremely well. The laws are stringent, but what happens is the laws are not required for people who are actually not taking it, and they are the ones that are following the law, and the ones that are breaking the law are going to break it anyway.
Yes.
So our problem is the laws should be as good as it is implemented, as we find. So what would be the kind of laws on those people who grow the pot Even in flower pots also, they grow this drugs. And even on the backyard, the gardens, terraces, we have seen in colleges, hostels, that they grow this. And then they sort of roll it into those cigarette kind of papers, and then they smoke it. And in those sort of cases, you don't have anyone supplying them. There is no question of 4,000 rupees, but they're actually growing it themselves. So, in such a situation, even the lower class and even the student population are able to afford it. And this is something which is going to become a menace. In fact, they say via Pakistan, Kashmir, and into Punjab, and the soil is just right for this kind of product to grow. And many people cultivate it because the crop gives you that much of returns. So, there is no law on this, is it?
No, there is a law in this. Even the cultivation of these narcotic drugs is allowed in some regions. I can give you examples of borders of Andhra or Telangana. There are some farms which are cultivated by farmers under regulation of the government of India, which are allowed to be cultivated, but that drugs or the cultivation is commonly used as a medicinal purpose in standardized form. I can give you example of this, cough syrups we have. We have codeine in this. Again, one of the opium related drug, but that is standardized. It has to be used till that limit only. So that is cultivated under permission, but as you rightly said, it is illegally cultivated even in pots and in some part of Punjab area. If you go along the railway tracks also, if you go your train, you can see cultivation. I've seen that somewhere implementation of law, even though the law is same in total country, but implementation is with the state government how to implement, and maybe some states implement it stringently and some state are somewhat, we can say, are not stringent on this, because it is just like, you know everything, but you don't act. It is rightly said by common men, if police are so stringent enough, हिंदी में एक फिल्म में भी मिलता है कि पुलिस के पास इतनी इंफॉर्मेशन होती है कि मंदिर के बाहर की चप्पल भी चोरी नहीं हो सकती. So it is up to the implementation of the law, what is to be made properly. But what I would say, if we could ask the government that the education related to the misuse of these drugs, if they have some chapters. See what is happening in cities now, metropolis, in last 10 years, if you go through the statistical data, we are moving towards rapid urbanization in this rural country. Initially, 15 years before, when we were in, say, medical colleges, we used to hear that India stays in rural area. Undoubtedly, it is truth also. But in last 15 years, there is heavy urbanization. Now, if you go to a district area, say of Maharashtra also, or any state, you can see the cosmopolitan culture getting inside the district areas also. There is rapid urbanization.
Yes.
What we need is that this adolescent age, what I am feared is above 18 years, undoubtedly, we track them, but we have a reported cases in some schools or colleges also, maybe in metropolis, that they are also developed an habit of taking, they are smoking. Nowadays, smoking is a social symbol also. You can see on media and social media and everyone. But what is worst affected is now the age group. Say after 8th standard, we take 13 to 16 or 17 or 18, which we say it is an adolescent age. This age we need to target. If you educate this age in above 8th standard till 12th standard, if we educate them properly, by education only, instead of punishment, we can curtail this drug abuse and drug users in say 20 age and above. Because we cannot avoid rave parties, we cannot avoid nightlife parties. It is a part and parcel of your social life.
Yes, Rajesh. I think, we've been listening so much about it, Rajesh, with so much of wealth of knowledge. I think the main point you say is to inculcate education. And now that we have come to the end of the program, what I would like to put just as a single point, may I ask Anjali, what would your message be to the people of Kashmir, Punjab, Haryana, and perhaps other states where this is rampant? Just a single line answer, Anjali.
Right. So I think we all need to come together. The government needs to have, to treat this as beautifully as they treated COVID. So instead of waiting people to come to us for treatment, I think we need to go to schools, colleges, families, whatever it is. And we need to identify and help them. And when I say help them, we need to screen these people for mental issues, for psychiatric disorders, because a lot of them will be suffering from anxiety, from depression, or are disturbed by what is happening around them. So we need to have proactive programs to help the youth to remain on a positive track and not get swayed by what is happening around us.
Dr. Satpreet, your views on this?
Ma'am, from whatever I've been through and whatever I've seen and what I have documented, I have a very big view, at least for the next 15 to 20 years. Punjab, we have lost a generation, actually. We have lost a generation. Either the boys are kids, or they have all left for Canada or Australia or New Zealand, because the parents are so scared for their children's health, and so scared that they might get into these wrong habits, that as soon as they finish their class 10th, they are put into IELTS classes, from where they will do anything and everything possible to leave the country and maybe go somewhere, wherever they can. And we have a big gap right now in the two groups. Like a generational gap has become much bigger, because almost one generation has left us.
That is true, Sabreet, and also Anjali and Dr. Rajesh. You've been excellent panelists. You've actually hit the point. The main secret password here is we and not I. I think collectively we can do so much. Individually, I think we will fail. I think the COVID example was excellent. The Pulse Polio program is excellent. I think collectively we should not run away from the country, but we must stand there and fight. And the other word is integrate. I think integrate all forms of medicine. It's not only about doctors. It should be Ayush, it should be the health sector, it should be the administrative sector, and all, whether it is the Anganwadi workers, it should be the nurses, and it should be the male health workers, anybody you get. Because once you miss one drug addict, that means that entire community is lost. So let us all pledge on this Doctor's Day, help Medscape and each and every person that's passing through our clinics or anywhere in society. If we identify somebody, let's make sure that we go to the end and hand these people over, even if we are not treating them, to see that they reach that destination so that they can get taken care of, and we don't miss that opportunity. So on this day, on the 1st of July, the balloons are going to be released. And I would also like to say that these balloons are for peace, prosperity, and happiness. And thank you very much for listening to this program. And I hope all of you will take this message home, that nothing happens alone and everything happens together. Thank you very much.
Thank you. Thank you. Thank you very much.
Thank you.
Thank you so much.
Drugs-free India is a reality, and today, at the International Doctors' Day, all the doctors along with Medscape India will pledge towards our next mission of drugs-free youth and drugs-free India. Thank you, Dr. Rajesh Dere, Dr. Anjali Chabria, Dr. Gill, and our chairperson, Dr. Kamini Rao. Thank you so much. Ladies and gentlemen, we always speak about the 4 pillars of life, but here we have the 4 engines of health and healing. So, let me ask you, what happens if the engine breaks down? It's no rocket science. The machine breaks down too. Similarly, our health also breaks down. And so, we call it the health engine. That's truly an interesting word. More interesting is our next session, titled The 4 Engines of Health and Healing. And to explain these 4 engines, NMCR, nutrition, movement, connection, rest, we have 2 solid engines with 4-stroke performance. So please join me in welcoming our former CEO of KPMG India, chartered accountant, leading various national international institutes, a mentor and investor in many startups. He's none other than Dr. Richard Recchi. A wholehearty welcome to you, Dr. Richard. How are you doing today? Truly a hearty welcome to you. And to shoulder him the responsibility, let's also welcome the co-founder of the Health Revolution, involved in building the ecosystem to shoulder him the responsibility. Let's also welcome our co-founder of our Health Revolution, involved in building ecosystem for healing-based understanding of human anatomy, certified emergency physician from Virginia, United States of America. May we please welcome Dr. Anup Kumar. We welcome you, dear sir. Thank you so much for joining us from the United States. Thank you to both our gentlemen for this.
Hello, everybody. My name is Richard Recchi. I would like to welcome you all to this session on the 4 engines of health and healing. I'm very happy to participate for this discussion on the occasion of Doctors' Day. And through this platform, I would extend our heartfelt gratitude to all the doctors for their human service, unwavering commitment, and for the high quality, compassionate care that they have been providing to people, especially during the COVID times. I would also like to thank all the other medical staff and frontline workers for their tireless and selfless service. Doctors have duty towards not only treating the patients, but also ensuring effective healing and how they can lead a more healthy life. For this reason, today we have chosen this topic where we will be discussing the 4 engines of health and healing over a fireside chat with Dr. Anup Kumar, who is from the US. He weaves his vision of healing using the threads of mind-body flow theory and the 4 engines, which are nutrition, movement, connection, and rest, to show how it is possible for people to heal from conditions that earlier were thought not healable. These engines, when applied across the body and mind, can facilitate healing in ways where other approaches are still trying to replicate. I will now start my conversation with Dr. Kumar to know how about these engines in detail and what is this theory that he's brought and what is this new healing that he's talking about. Dr. Kumar, Dr. Anup Kumar, welcome to this fireside chat.
Thank you, Richard. It's a pleasure to be with you here.
Yeah. Dr. Kumar, the first question that I have, and we will go along as we go, and if there are any areas which you think have not been covered through this Q&A, I would request you to further elaborate on them. Sure. Given the pandemic crisis across the world, how do you feel these 4 engines of health and healing would work? Can you elaborate on the whole concept of these 4 engines of health and healing for the audience and for me? Thank you.
Yeah, so let me start by echoing your words, Richard. Just a thank you to all my fellow colleagues around the world. It has been quite a difficult past couple of years for everybody. whether we're in the general public, whether we're talking about physicians, whether we're talking about patients in the hospital. For everybody, it's been difficult. None of us really knew what to make of this, for the first 6 months to a year. We were still figuring it out, and we are still to some extent. So thank you. I'm in the emergency department here in the United States. It was very difficult in the beginning, and I appreciate everything that my fellow physicians have done. Having said that, yes, when it comes to the 4 engines, Richard, one of the things that we have to do a better job of is emphasizing what is too often just brushed aside as lifestyle medicine, right? People will say, oh yeah, you got to eat your fruits and vegetables. Oh yeah, get some exercise. That's lifestyle medicine. That's preventative care. But I think we have to take these basics much more seriously. And these basics of the 4 engines are nutrition, movement, connection, and rest. And these apply not just to the physical system, but to the mental system, to the entire human organism, whether we're calling it physical or mental or at whatever level we're speaking about it. So these 4 engines apply across the human system. And when we act on these, what we see is that the overall health of the organism increases. In fact, if you look at the statistics from COVID-19, you will see that the people that are most affected will be those with weakened immune systems, right? So people who already have multiple comorbidities, they might have existing severe hypertension or diabetes or obesity or many other conditions. And when a person has several of these together, their morbidity goes up and the risk of mortality goes up. And guess what are the things that improve those conditions? It's the 4 engines. It's nutrition, movement, connection, and rest. But the messaging overall in the pandemic has been largely defensive, right? It's been social distancing, which has been effective. It's been vaccinations, which have been effective. But being on the defensive is not enough, right? In business, I know in medicine, when something comes along, always playing defense is not a good enough strategy. So the offensive strategy is to say, how do I increase my health? How do I increase my vibrance? How do I increase my vitality such that when we do meet with difficult situations, which is inevitable in life, when we do, then we have a better chance of being successful. We know that many or most people actually do quite well, even with COVID-19 infection, because their immune systems are okay. But certainly the people who have these comorbid conditions or are elderly, they're at much greater risk. This is where the power of the 4 engines comes forth, that we can have a strategy that increases our vitality. And by the way, is not only just effective for COVID-19, but is effective for the entire spectrum of diseases. So if you'd like, I can go a little bit more into these 4 engines now.
Sure. Dr. Anup, I think the important part is I've understood these 4 engines. I mean, they are very, very well laid out. I'm sure the audience would like to know, like I would also like to know, is there a method to this? If we want to follow this regime, is there something that we need to do to make it sort of institutionalize it, for a better word? Is there something we can do about it?
There is something, and the first thing, Richard, is naming it, right? The first thing is stating it, because as you know, there's so much talk in the space of health and well-being today, and much of it is useful. But the question is, how do we go forward and systematize an approach, right? Because if it's just haphazard, any one of a number of things, and there's no systematic approach, then it's not going to be the same in one city or in one country. In another country, everybody's doing something else, and we're not actually getting anywhere in a systematic way. A good example is if you have an appendectomy today. If somebody has appendicitis and they need to have an appendectomy, more or less, there are a few basic ways to do it. Whether you're in India, whether you're in the United States, whether you're in Germany, it's a few basic ways to do it. And that standardization is what gives us that level of expertise and that level of competence in addressing it properly. So similarly, when it comes to health and well-being, these are the 4 major engines: nutrition, movement, connection, and rest. And it's important that everybody looks at all 4 of these and says, what is one activity I can choose? What is one step I can take in each of these areas? And if I'm taking it in 2 of the 4 or in 3 of the 4, what is that 4th one? Let me pick something in that area. So in nutrition, it might be something simple like moving away from processed foods and moving towards fresh plant-based foods, right? It's a very simple one for nutrition. There's much more, of course, but a simple example in the nutrition spectrum is, let me move away from these processed foods and move towards fresh, whole foods, plant-based foods. In the movement section, one thing that we can do is simply stretch every day. If a person can exercise an hour a day, fantastic, that's great. But it's important that we realize it doesn't have to be 100%. And only if it's 100% doesn't count. No, we can get there step by step. Let's take a step in the right direction. So getting up every day, maybe every morning, every evening, stretching the full range of motion of every joint, right? Every joint, not just the usual jumping jacks and all that, but recognizing that every joint in the body has a range of motion and it is significant and adds to our strength, adds to our balance. That's a great start with movement. When it comes to rest, understanding that, yes, there's a lot to do in a day, but let me also learn how to say no. Let me learn how to say, no, these 30 minutes I need for myself. This is for me. It's not to achieve some goal. It's not to get somewhere. It's not to tick off a box. It's because I enjoy being myself and I want to feel what it's like to be myself, right? Rest. And of course, connection is that meditative aspect, going inward and recognizing the deeper aspect of being human that goes beyond physicality. So these are 4 simple examples. Rest can also be sleep, right? Rest can also be maybe curling up with a book. There are any number of things one can do. But it's important to recognize that all 4 of these engines are important when it comes to health and healing. So choose one in each category, and you will see the changes in life that happen when this is practiced over and over.
Yeah, the one point that keeps coming to my mind, and the one item that came out in this whole, it got further compounded or exemplified during COVID, but it was there earlier when people suffered from cancer or from similarly all these different kind of diseases, was your immunity levels. Now, like you did mention that everybody has different immunity levels. Now, do you think enough work has been done in this area of immunity? Do you think we need to do more work around the immunity side to, build stronger immunity in humans so that they can take on these when they come?
Of course, we absolutely do. And, the trend in medicine is towards personalization, right? So over a decade ago, we heard about precision medicine and precision genomics. And today you can see there's a big push for precision microbiome testing, right? To test the bacteria that are in the gut and to see what foods match with those bacteria, or to do saliva testing for our ancestry and our genes. So there's this big push towards personalization. At the same time, though there's a role for this, what we're seeing is that the low-hanging fruit, which is so powerful, is being left on the table. And, I can do advanced microbiome testing, but I don't need to do that to move away from the processed foods and to move towards fresh, whole, plant-based foods, right? I don't need so many studies to tell me that fresh food is better than processed food. And so what's happening is, in this favor of this technological view of what's happening, we're kind of missing out on the incredible technology of the human system that already exists, right? Just like a sports car, if you fuel it up with the lowest grade octane, it's not going to function well. And we don't need so many studies to then find out what's going wrong. First, we have to optimize what we know. Then let's go for the more precision, more advanced things, right? On the other hand, in the human system, if we're putting low-grade fuel, so to speak, in the system, then we can expect what the output is. There are studies after studies that show that, for example, by switching to a plant-based diet, that one can arrest or even reverse heart disease. We have the angiograms to show it, that we can reverse heart disease. But most patients don't know this. In fact, I would say most physicians don't know this, that by switching to a particular diet, that you can actually reverse heart disease. It's generally not heard of. We think of either stents or surgery, but no, these can actually help. So yes, all of these are important and all of these have a role to play. And when we make these changes, again, just a couple examples of nutrition or connection, or movement also includes moving our emotions, by the way, looking into our past, moving the emotions that have been suppressed. we see dramatic increases in health. And that comes from the immune system, right? The original question was about immunity. What does it mean to increase immunity? Anytime we're healing from anything, it is the immune system at play. That is, the healing system of the human being is the immune system. And so when we are healing, the immune system is play. The key is, what are the nutrients that we're giving to this immune system so that it can function with the most vitality? And this is where the 4 engines come in.
Okay, thank you. I think that was quite elaborate. And I just want to take this again, 4 engines, and say, how is this going to help in the health and healing process for women and girls? Do you think this will help there? Because each human has a very different kind of thing.
So one of the unique aspects of the 4 engines is it goes beyond just the physical system, right? So the 4 engines connects what we're doing physically, what we're doing mentally, what we're doing spiritually, and what we're doing societally, what we're doing in the environment. So nutrition then is not only what we eat, but it's the stories that we tell. Right? The story that we're having now, the conversation we're having now, Richard, is a nutritive story, right? It's nourishing us in some way, just having an exchange, having a creative exchange. So one of the key things that comes up here is, what are the stories that we're telling about girls and women in society, right? Are girls growing up knowing that they can be the greatest leaders of tomorrow? Are girls growing up in environments that we are supporting their health, that they have the supplies they need in the educational environment, in the work environment, to meet the unique needs of a woman? Are they comfortable talking about their bodies? Are they comfortable talking about their relationships? Or are they stuck in stories that keep them suppressed, that keep them less than, right? The stories we tell about, and this is very relevant, by the way, in the United States now, because of a major law that's been overturned in the United States with regard to women's reproductive health. So the stories we tell are nutrition, and that has such an effect on what a girl thinks is possible, what they can become. And that, of course, has a direct result on the body, on the physiology of the body, and on our health. So this is a key area, not only in terms of the stories we tell, but in terms of the actions that we take in society and the facilities that we provide for girls and women to become all that they are capable of being.
Yeah, thank you. I think this will be good because this organization actually deals a lot with women and girls. So I think this was some great input for that, for them. Somewhere along the way, you did allude to connectivity, and you did allude to, I wouldn't say exactly spirituality, but you did speak of the oneness of mind and body. So what role does spirituality have to play and in this entire healing process, and how important it is today, especially in the world in which we live in today?
Yeah, this is a great question, and a very important one today in medicine, in healthcare, actually in all of society. And this is why, Richard, these categories that we call science, philosophy, spirituality, religion, what are the walls that divide these categories? What are the walls that say this is philosophy and this is science and this is spirituality? Of course, we invented the walls, right? We human beings in the society, given the education that we've had, given the range of perception and experience that we have, we create these conceptual walls that this is philosophy, this is science, right? In fact, what is called science today in Isaac Newton's time was called natural philosophy. Right? It's a very clear example of the walls that we create are our own conceptual walls. And I say this because what we call spirituality tends to generally be the more subjective experience, as opposed to what we call science tends to be the more objective experience. But what we're forgetting is that to have a subjective experience, there has to be an objective experience, even if that object is something subtle like a thought. I may be aware of a thought. I may be aware of a feeling. On the other hand, from the scientific perspective, if I'm doing a study and I'm looking at human anatomy, then to look at that anatomy, there has to be a subjective experience also. Myself and my own awareness is the subjective aspect that is aware of the objective notion of the body. So whether a person considers spirituality or the person considers science, the objective and subjective poles of experience are always dancing with each other. And so once we recognize this, then we can move beyond some of the conceptual walls that are there. And we can simply say, how are these two relating? What is the relationship between this subject that is perceiving and this object that is being perceived? And how can we understand this better for health and healing? And this is where we move beyond the walls of this is spirituality and that is science and this is philosophy. We can still be rigorous. We can still make observations, form hypotheses, conduct experiments, right? This is the cyclical process of science: observing, hypothesizing, and experimenting. And once more, observing, hypothesizing, and experimenting. Well, if you look at what we call spirituality, it's the same. I have a hypothesis about what can happen when I hold my attention in a particular way. That might be the meditative experiment. I conduct the experiment, I see the result, and now I hypothesize something new. I keep going in that track, or I try something else. So once we see this, what we start to see is that what we're calling this physical structure, the physical body, is in itself inextricably entangled with mind. There's nobody who has experienced a body without there being a mind to experience it, right? So the question we have to answer is, what exactly is the relationship? We know they're entangled. We know where one is there, the other seems to be there. So what exactly is this relationship? And this is where mind-body flow theory comes in, where we hypothesize that what we call this body is itself a representation of mind. So by my body itself is representing what Anup is and the constitution of Anup's mind is at different levels. And by seeing this, we can start to act on the deeper layers of the mind to change the body. I'll give you a quick example so that it's not as abstract. We have one person who on our podcast who healed from Crohn's disease. Crohn's disease is an inflammatory condition of the bowel, and it often is treated by immunosuppressants to suppress the immune system because the immune system is too active in this case. And because of all the activity, there can be scarring in the bowel, there's pain, the bowel can get obstructed, a person can need surgery. And all of this was the case in the case of Jacqueline, one of our guests. And she tried everything. She tried many of the pillars. She tried nutrition. She tried rest, right? And she, of course, tried all the conventional treatments, all the steroids, the immunotherapy, etc. Nothing worked for decades. Then she tried something that was thought to be quite strange, Richard. She tried hypnosis, which sounds strange because, again, we're always looking at the objective pole of the body without recognizing the subjective pole of the mind that is ever present with the body. So she decided to shift the focus from the objective pole to the subjective pole. And I can tell you, Richard, that after 90 minutes of this, she has not had a symptom in over 4 years. And when she had a repeat colonoscopy, the entire intestine was shown to be normal. And her gastroenterologist said, I would never believe this if I didn't see it myself. But the amazing thing is not just that. The amazing thing is that stories like that happen all the time. But we don't have a mechanism of understanding that allows it to bring it into the realm of reason. So we say that is spiritual, that is esoteric, that is mystical. This is science. This is what we focus on. So how can we broaden that conversation? We do that by recognizing that the mind and body are one continuous flow. And by shifting our attention, we can access and moving through these pillars of, that was the pillar of connection, by the way, connecting to one's deeper nature, and also movement, process of moving suppressed emotions. In moving that mind, the body itself, in a sense, moved. So this continuity of mind and body does not have to be only a spiritual notion. It is equally spiritual, philosophical, scientific, and practical.
I think, Anup, that was a fantastic story. I think this is a real life story, and I know you're doing some great work through your podcast where you are bringing a lot of these stories to life. And I'm sure a lot of the audience, whoever is listening to you over those podcasts, must be benefiting from it, because when you hear these stories, you want to experiment yourself. But I think this was a great example to show how mind and body flow is just one, and they're not two separate. I think for the audience, it's a great example, and obviously there'll be many more examples like this. But thank you very much for sharing this. The one point I want to ask you, Anup, because we are all living in a very fast-paced world. We're living in a rat race. I was a part of that rat race at some point of time, doing exactly all those stupid things that we all do when we want to be in our corporate life. What advice would you give young people, middle-aged, little older people who are in this rat race, to step back? And is there some kind of advice you would like to leave with them, how they can change the way their outlook, instead of going to the edge and then trying to pull yourself back before you get to that place of no return? There is no return. What I'm hearing from you, there is no thing as no return, right? I mean, that's what I heard from you. But how do we actually move in that direction where we could do it from very early? And for the younger people who are listening, it may be a great thing for them.
Yeah. A very important question. Let me say that I also have been part of the race, Richard, not just yourself. And I'm sure many people listening, especially if you're physicians,
Yes.
you have also been and are probably in the rat race. The thing about a rat race is even if you win the race, you're still a rat. So you might want to reconsider running this race. In medicine, it's you become a medical student, and then there's a certain level of I made it associated with that. Then you get your degree, your medical doctorate, and then you're a resident, and now you're fully treating patients, and there's a certain level of yes, I made it that comes with that. And then you're a physician, and then your salary goes up, and then you get the prestige in society. And now, yes, I definitely made it. This can happen as well. So what happens all along is that we're taking on these subsidiary identities, right? And the fact is, all along is that child who was 5 years old and was scolded that one day and told that they have to do this particular thing, and that's what makes them valuable, that child is still there at age 30, 40, 50, 60, 80, 90, right? So it's important to recognize that we can take on roles, right? I'm very happy about the work I do as an emergency physician. I'm very grateful to be able to help people in the way that we do. And at the same time, it is crystal clear to me that what I am fundamentally is not an emergency physician. An emergency physician is an identity that I have. It's a training that I have. It's a very useful skill and ability that I have in society. And what I am is more than this. And this is true of everyone. So a very simple thing that I would tell anybody, regardless of what your profession is or whether you even have a profession, it doesn't matter, is that it's okay to step away from the groupthink. Okay, I want to say that again. It's okay to step away from the groupthink. The value of a human being is simply in living. The fact that we are here, the fact that we exist, means that there is something tremendous happening. I mean, this thing called life is unbelievable. We still don't know what life is. It's still one of the biggest questions in science. We have some ideas about characteristics of life, but what is life fundamentally? We don't know. It is a tremendous activity, a tremendous process. And this has tremendous intrinsic value. And that is the value, in my view, of Anup, of Richard, of everybody listening, is that this life is pulsating within us and pulsating through us and expressing through us. Now, how we choose to entrain that, what field we choose or do not choose, what activity we choose or do not choose, is a choice. It's a product of culture. It's a product of our upbringing. It's a product of circumstance. And our value does not come from that. So it is okay to step back from the groupthink and reconsider the stories you've been told about who you are, what you're capable of, and what is okay in terms of your expression in this world. It was difficult for me, Richard, when I first started talking about some of these things. When I was writing my first book, I'd always stop, say, do I really want to say that? That's kind of tough. Do I really want to say this? One of the chapters in the book was, dear It was like Dear Physician or a letter to my fellow clinicians, right? Where I had to say some difficult things that I think are really important for physicians and for patients. And that required me to step away from the groupthink while valuing what we know, also stepping away enough to say, here's what we don't know, and to spotlight that. So for everybody there, know that your value comes simply from being alive in itself and not from something that you are doing, and that it is okay to reconsider the stories you've been told.
Thank you, Anup. I think that was very nice the way you have ended it, being alive. And I remember very clearly, I had learned about many years back, one very young girl came and told me a story of a 5-ball theory. The 5 balls are work, health, family, friends, and soul. You spoke about connectivity, the soul. And what she said was the job is, or the work is the rubber. That ball is rubber. The rest are glass. If the rubber ball falls, it can bounce back even higher. But the other 4, if they fall, they're all glass balls and they will never be the same again. So I think it has been great talking to you, Anup, on this. I think I've taken away a lot of things, especially you said if you're in comorbidity and wherever you may be, all those things can be reversible as long as we take it into our own hands and work on it. We have to try different experiments to get there. But why do we want to even get there? Can't we just not move from now, get into fresh foods, plant-based foods, rest, connectivity, nutrition, everything what you have spoken about is fantastic. And I think I'm sure the audience will take away a lot from this. I really appreciate your time and coming on this fireside chat. It has been amazing talking to you. I've learned a lot today. I'm sure the audience would have also. We'll learn a lot about this from what you spoke. Thank you very much, Anup. And I would also like to take this opportunity to thank Dr. Sunita Dubey and Medscape for all the great work they have been doing and for inviting us both to be on this fireside chat, and wish them all the best in all the good work that they have been doing in their various programs across the country, promoting fitness, etc., and also girl and women kind of empowerment. So thank you very much. Anup, anything last you want to say? Any last words for the audience?
Again, thank you to my fellow physicians out there. Thank you, Richard, for the conversation. Thank you, Dr. Sunita Dubey, for organizing this. It's been a pleasure speaking with you.
Thank you. Okay, bye.
For this fantabulous session on this very hatke topic of healing engines at this very amazing and prestigious 5th Fit India Conclave on this International Doctors' Day. Thank you once again. Thank you, Dr. Richard Rekhi and Dr. Anup Kumar. Shukriya. Thank you. Dear friends, our next topic is telestroke, remotely saving brain stroke. So when we talk about doctors, we're actually talking about brains. On this platform of the 5th Fit India Conclave by Medscape India on the International Doctors' Day, let's call upon our brain. Dr. Neurologist from Las Vegas, dealing with brain and brain stroke management since more than 20 years. May we please welcome this learned man, Dr. Navdeep Dhaliwal, to address us all on telestroke, remotely saving brain stroke. Thank you very much, dear sir, and thank you for joining us here. May we please give it up for Dr. Navdeep Dhaliwal ji.
Hello, my name is Navdeep Dhaliwal, and I'm a neurologist in US. And at present, I'm doing a telestroke. I'm involved in a telestroke program. And first of all, I wanted to wish on the Doctor's Day, I want to wish Dr. Sunita Dubey and all of her staff and team who is doing this amazing volunteer work, which is benefit people of India. And I wanted to present here the work I'm doing, as I feel that this will benefit people in India, especially remotely in remote areas. So I'm at present a faculty at VA National Telestroke Program. So we have this virtual program which we are running in throughout US in all 50 states. And so our program initially was funded in 2016, and the rationale for telestroke program at that time was there was a shortage of neurologists, and especially shortage of vascular neurologists. And as stroke is acute, time sensitive based treatment and intervention, so we came up with this program of telestroke, where we cover different hospitals virtually through a virtual program with different providers. So this is the data I'm going to present here. So acute ischemic stroke in the VA in 2018. This is the overall incidence of the stroke in the VA population. And designing a telestroke program, one has to establish institution support, define your network model, determine your technical protocols, and establish IT support, and also design a documentation system, establish ongoing measures to quality and outcome, and then go live. And other important thing is go slow and implement quality control on these things. Okay, and also in here, as I said, it was funded in 2016 by the VA, and then by the central VA program. So we started the first program in 2017, and in June of 2020 we had 40 VA hospitals throughout the country, which we were covering through this virtual program. And also the providers, the neurologists, the vascular neurologists were located throughout the country in different cities. So we have virtual hub and spoke model. Teleneurologist is at home or at an office, and the shifts we are doing is 6 to 12 hour shifts. And then also there's a staffing, one physician on call all the time. And then there is a backup physician. And also we have nursing triage, which takes the call and triage the severity. And then also the symptoms are passed on from nursing triage to the provider. And so we cover both VA hospital, rural and urban. And also the way the process work in our telestroke program is mentioned on this slide. If you look into is a veteran who is suspected of a stroke, who comes to the hospital locally within less than 8 hours of the onset, we are called on that case. And the facility requests telestroke consultation, telestroke MD video confirmed with the patient and local staff using FaceTime, and then the local facility completes a stat, CT, labs, and nursing orders. And the telestroke MD reviews the record and CT images, and telestroke MD recommends diagnosis, treatment, and post-treatment care. And local facility at that time execute treatment recommendations, and veterans either admitted locally or transferred to a higher level of a care depending upon what treatment options we are going to provide, such as like thrombectomy. And the main goal is less than 45 minutes time goal. And we have involved, there's a very expensive technology out there for telestroke, but we have involved, our program has got this basic technology through iPads. We communicate, and it's very economical considering the other equipment, which is quite expensive. So what we did was we bought some couple of stands, and then onto the hospital side and put iPads on the stands with the speakers. So the total cost for our units are coming out to the facility of each unit about $9,493 for 2 iPads and 2 stands. So considering this, its price is within a reach, and it's not expensive. And if you consider other equipment which is present in the market, it's quite expensive.
Thank you very much for this brainstorming session, Dr. Navdeep Dhaliwal, sir. Thanks a lot. Ladies and gentlemen, we are coming to the end of this beautiful day of the 5th Fit India Conclave by Medscape India on this International Doctors' Day. Medscape India is a pioneering organization in many healthcare sectors and subjects by the doctors, for the doctors, and of the doctors, dedicated to humanity worldwide. And that's Medscape India for you, ladies and gentlemen. Hope for the world, our doctors. Hope for the humanity, our doctors. Hope for this universe, our doctors. On this International Doctors' Day, Medscape India calls every human being to get united, be fit, and become super hit to serve humanity. And now, ladies and gentlemen, we are coming to the end of this beautiful day of the 5th Fit India Conclave by Medscape India on this International Doctors' Day. Medscape India is a pioneering organization in many healthcare sectors and subjects by the doctors, for the doctors, and of the doctors, dedicated to humanity worldwide. And that's Medscape India for you, ladies and gentlemen. Hope for the world, our doctors. Hope for the humanity, our doctors. Hope for this universe, our doctors. On this International Doctors' Day, Medscape India calls every human being to get united, be fit, and become super hit to serve humanity. And now, let's welcome one more legend on the Medscape India's 5th Fit India Conclave platform to propose the vote of thanks. This super class dental surgeon, the honorary ranker brigadier in Army Dental Corps, BC Ray Award winner, Padma Shri and Padma Bhushan, Dr. Anil Kohli. May we please, with the loudest round of applause, welcome Dr. Anil Kohli.
Good evening, everyone. It has been such an honor to be part of this wonderful event. On behalf of the organization, I would like to extend my heartfelt gratitude to our esteemed guests, Honorable Union Minister Shri Shripad Nayak, Honorable Minister Shri Narayan Raneji, Dr. Pramod Sawant, the Chief Minister of Goa, Dr. Rajesh Tope, the Health Minister of Maharashtra, Dr. Sunita Dubey, the radiologist and the chairperson of Medscape, the lady behind the whole project, and a torchbearer. We are thankful to His Excellency Bhagat Singh Koshyari, the Governor of Maharashtra, for his blessings and always supporting our movement. What we have witnessed for the past couple of years not only served as an eye-opener, but also made us realize that health is indeed a wealth. I came across an interesting fact in the newspaper the other day that the average life expectancy of an Indian has changed from 31 years at the time of independence to 69.7 in 2022. In common man's language, we are living longer. But on the other hand, that doesn't mean we are living better. Also, we are the 5th youngest nation in the world, where 65% of the population is below the age of 35. That emphasizes the need for inculcating the necessary changes needed for a healthy lifestyle in today's younger generation. Today, Medscape India is celebrating its 8th year of Fit India movement, which aims to make fitness as an integral part of everyone's daily life so as to ensure a healthy nation. It provided an opportunity for the health, wellness, and sports sector to come under one roof and work collectively toward the formulation of a holistic approach for the well-being of each and every individual in the nation. We would like to thank all the people who contributed to make it a big event successful. Brigadier Ratiraman Singh, Dr. Mukesh Batra, Dr. Atul Joshi, Dr. Sandeep Diwan, Dr. Mir Mushtaq, Dr. Kamini Rao, Dr. Sarpreet Gill, Dr. Anjali Chhabadiya, Dr. Rajesh Berai, Dr. Sushmita Bhatnagar, Dr. Mohsin Wali, Dr. Naina Ingole, Dr. Richard Veki, Dr. Anup Kumar, and Dr. Sandesh Maikar. I consider people like Dr. Mohsin Wali, Dr. Sunita Dubey, and Sandesh Maikar a paragon of virtue whose work has been exemplary and has inspired all of us with their work and dedication. A special thanks to all the doctors from the valley as well as from across the country and all over the globe who are working tirelessly to bring out the much needed change for the benefit of the people of Kashmir and for a peaceful and for prosperous society in Kashmir. We collectively, as a fraternity, thank our Honorable Prime Minister Narendra Modi ji, who supported this and initiated this movement on 29th August 2019. As it always said, everything starts at a grassroots level. This movement is India's first step as a nation towards building a healthy world. Jai Hind.
Our humble thanks to Padma Bhushan, Dr. Anil Kohli ji, and it's been truly a wonderful celebration here today on the International Doctors' Day, brought to us by Medscape India. I take this wondrous opportunity of thanking the lovely lady who makes it possible for the entire world to be aware regards health. Thank you to Dr. Sunita Dubey ji. Ladies and gentlemen, my name is Simran Ahuja, and I'd love to express my gratitude. As we all know, doctors are a miracle of God. Thank you, God, for that brilliant miracle. Thank you, God, for that brilliant miracle. Doctors, humble thanks to one and all.
ना दुख की तुमको धूप लगे ना सांसों की टूटे लड़ी सांसों की टूटे लड़ी ना सांसों की टूटे लड़ी
ना दुख की तुमको धूप लगे ना सांसों की टूटे लड़ी
ना फिक्र करो ना फिक्र करो ना फिक्र करो ना फिक्र करो
हर लम्हा हर घड़ी
हम तुम्हारे साथ हैं हम तुम्हारे साथ हैं हम तुम्हारे साथ हैं हम तुम्हारे साथ हैं तुम्हारे साथ doctors, we're always there for you. We are the doctors, we're always there for you. We are the doctors, we're always there for you.
भगवान नहीं इंसान है हम सेवा के लिए कुर्बान है हम
भगवान नहीं इंसान है हम सेवा के लिए कुर्बान है हम
सबके लिए दिल में जगह मानवता की पहचान है हम ना फिक्र करो ना फिक्र करो ना फिक्र करो ना फिक्र करो हर लम्हा हर घड़ी हम तुम्हारे साथ हैं हम तुम्हारे साथ हैं हम तुम्हारे
वाले ने जन्म दिया, हम इसकी सुरक्षा करते हैं।
ऊपर वाले ने जन्म दिया, हम इसकी सुरक्षा करते हैं। जहाँ हो ना कोई तकलीफ कभी ऐसी व्यवस्था करते हैं। ना फिक्र करो, ना फिक्र करो, ना फिक्र करो, ना फिक्र करो। हर लम्हा हर घड़ी हम तुम्हारे साथ हैं, तुम्हारे साथ हैं, हम तुम्हारे साथ हैं, तुम्हारे साथ हैं, तुम्हारे साथ हैं। We are the doctors, we're always there for you. We are the doctors, we're always there for you. We are the doctors, we're always there for you. We are the doctors, we're always there for you.